Good morning and welcome, everyone. I'm calling the 439th Council meeting to order. Welcome to all those here in person on King West and to all those who are joining us remotely. Regardless of where you are, Council members, please have your video on during the meeting and mute yourself if you are not speaking. We are live streaming this meeting through the RCDSO's YouTube channel so that members of the public, profession, and other stakeholders can watch our proceedings. Before we begin the formal meeting this morning, I'd like to underline for Council the ongoing improvements meeting process. You'll see from the agenda today that we have fewer topics and more time for discussion. This will help to encourage deeper conversation and diversity in discussion. The President and Registrar are also looking at the meeting schedule for 2024 to support the work we have to do as Council and the ongoing education that is so important to your discussions. And just a quick reminder to please use your Zoom hands for voting, questions, and comments, whether you are attending in person or remotely. And now I would like to turn to the official opening of our meeting with the land acknowledgement. The RCDSO is on the traditional lands of the Mississaugas of the Credit, the Anishinaabe, the Haudenosaunee, and the Huron-Wendat peoples, known to some as Toronto. Toronto is covered by Treaty 13 with the Mississaugas of the Credit and is home to many diverse First Nations, Inuit, and Métis peoples from across Turtle Island. This land is also part of the Dish with One Spoon territory, a treaty between allied nations to peaceably share and care for this land. We accept our responsibility to each other and this land we live and work on in a spirit of peace, friendship, and respect. We are committed to actively supporting the necessary work towards truth, reconciliation, and equity. We embrace the role that we play in regulating dentists, in protecting the public interest, and in strengthening our partnerships with Indigenous communities to advance access to safe and equitable oral health care. And at this point in time, I'm going to turn it over to the Registrar to do the roll. Dan?
Thank you, Hanno. So I'll do the roll call in alphabetical order. Just be prepared with your mics and muting to announce your presence. Nalan Bhargava.
Present.
David Bishop. David's not here. Amelia Chan.
Present.
Ram Chopra.
Present.
Jamie Colliver.
Present.
Christina Cordero.
Present.
Peter Delane.
Present.
Nancy DeSanto.
Present.
Mark Eckler.
Present.
Ellie Fisher.
Present.
Noah Goma. Noah's not here today. Daniel Haas.
Present.
Vivian Hu.
Present.
Nizar Ladak.
Present.
Anthony Licio.
Present.
Anthony Mayer. I believe Anthony Mayer sent regrets. Harinder Sandhu.
Present.
Brian Smith has also sent regrets. Usama Solomon. Okay, Osama's not here. Robin Somerville.
Present.
Rod Stapleforth.
Present.
Mark Trudell.
Present.
Aaron Walker. Judy Welikovich. And Deborah Wilson.
Present.
Thank you very much. Over to you, Hanno.
Thank you. And to work the mics, because your audio is not going through the computer, you have the microphone in front of you, you have a little sort of face with voice is coming out. If you touch that, you have to make sure that this part stays red, and then you're mic'd. So if you touch it and it doesn't go red, that means people aren't going to be able to hear you. So that's just a little bit of a heads up for that. Thank you, Dan. And now I'm going to ask Dr. Harinder Sandhu to provide the President's remarks. Harinder?
Thank you, Hanno, and good morning, everyone. It's very good to see you all today. It's particularly nice to see all of you who were able to make it in person. Bill Nye famously said, "Everyone you meet knows something you don't." And at its heart, that is the purpose of our work here at Council. Each of us bring something significant and important to every discussion. Each of us brings the public interest to bear in a unique way. At our June council meeting, we had a healthy conversation about ensuring that we have time for meaningful discussions. I support that fully. At our executive meeting in July, we explored a number of ways to create space for more council input. Today, we will test that out. On the agenda, we have a number of items, but there is one strategic item that requires your significant input. It concerns the task force report on the professional liability program. We have space on the agenda for 2 hours for this conversation. I look forward to hearing from all of you. The chair, the registrar, and I will work together at council meetings to continually improve the caliber of our discussion. All of council helps to ensure that we have good questions and good participation. I thank you for that. Later today, council will hear more about how we are getting ready for the emergency class of regulation. It was approved by you in April and at our special meeting of council in August. The working group was active over the summer. We addressed a number of issues to ensure effective, responsible implementation if government or council needs to invoke the provision. We focused primarily on guidance for supervision of registrants in the emergency class, which is a key public safety element of the regulation. Finally, I'm very pleased to note that we are reaching a significant milestone in our governance modernization. You will be hearing this afternoon from Maureen Boone, panel chair of the Eligibility Review Committee, on the recommendations for our first governance committee. I would like to take a moment to note all those who help prepare for council meetings. You help us focus on decision-making with facts, context, and advice. Thank you. Dan, the senior leadership team, and the entire staff of the college, thank you for your dedication to the important business of regulation. As council, we will hear today, you and your team are moving the organization forward every day. Thank you to my fellow council members for your thoughtful guidance and for your attentiveness to the public interest. I would like to acknowledge the members of the public who are joining us through YouTube. We appreciate your interest and hope that you find value and insight in these discussions. So thank you for being here, and we welcome your feedback. With that, Hannah, I'll turn it back to you.
Thank you, Harinder. Next on the agenda is declaration of conflicts of interest. Conflicts of interest are important to declare because of our public interest mandate and as a standard reflected in the Ministry of Health College Performance Measurement Framework. So at this point in time, I will pause, look around the table to see if there are any people who have a conflict of interest to declare for any of the items on today's agenda. Thank you. I see none. Now let's turn to the consent agenda, please. We are continuing to use the consent agenda as a time-saving mechanism. On the consent agenda are a number of items that are for Council's information, acceptance, and ratification. Council will be asked to approve these in one motion. Council may ask any clarifying questions about an item on the consent agenda, but if someone wishes a deeper discussion about an item, we will take it out of the consent agenda and address it later at our meeting. I would ask, though, that you use a very high threshold when asking to remove an item from the consent agenda, and this is to ensure that we are reserving time for thoughtful and focused discussion on our more important decision items. The items for the consent agenda are in your meeting package, starting at page 9 to page 80. Are there any questions about the items contained on those pages in your package? Seeing none, could I please have motion number 1 presented on the screen? And motion number 1 is that the following items be approved and or received for information by council. Approval of agenda, approval of RCDSO Council meeting minutes, June 15th, 2023, approval of RCDSO Council meeting minutes, August 3rd, 2023, Registrar and CEO report, Standards of Practice Update, Council Evaluation Survey Results, June 15th, 2023, Council Evaluation Survey Results, August 3rd, 2023, Q2 Financial Update, Public Member Appointment, 2023 Work Plan for Council Approval, and Appointment to Inquiries, Complaints, and Reports Committee, ICRC, ratification. So at this point in time, I am looking for a mover, and again, I would ask if you are prepared to do that, that you raise your virtual hand. That's moved by Vivian, seconded by Mark. All those in favor, and again, please raise your virtual hand and keep it raised so that Angie and I can do the count, and we will tell you when we are going to ask you to lower it. So Angie, I'm seeing that as being unanimously accepted. So that motion is carried. Thank you. And now I will ask you to lower your virtual hand. Thank you for that. Next, we're going to move to the Registrar and CEO's report. The consent agenda that's in your package, pages 42 to 59, and I'm going to turn it over to Dan, who will speak briefly about his report. Dan.
Thank you, Hanno. Good morning, Council, and there is a slide deck if we could get that posted, please. First of all, I want to acknowledge that this report is a compilation of a lot of hard work and effort by a great team. Some, not many, some are sitting over there to your right and left, and they will be able to answer any questions that I'm not able to. Could I have the next slide? What I want to do is talk a little bit first about what we're calling the Corporate Dashboard Report. This is information from our program areas that allows us to know that we're making progress and that we're achieving on a number of really important items that we're moving towards. And so the nature of this report will change. We will change the things that are important and of interest, and this will be of some use to you so that you can see some of the more significant highlights from a governance perspective. But this is of great interest to our leaders who are monitoring all of the data and using it to improve performance every single day. Next slide. You have slides in your materials, and I'm not going to go through every one, but I want to highlight a few for you. First, what you have on screen are the areas that we're looking at currently. There are a lot of other key performance indicators from our internal operational standpoint. They might relate to human resources or finance and so on. You get some of those in other ways. But right now we're looking at the 4 regulatory functions of the college, and we're looking at IT to some degree. One of you asked a question or made a comment at the last meeting, are we asking the right questions? And I think what we are asking right now, as you can see, are questions that more relate to progress on significant issues and questions that relate to timelines or volumes where we can measure them more readily. But I can assure you that as we move forward over the next coming months and years, we will be looking more at the quality of our outcomes and the quality of our processes, and you'll get a changing flavor of what the corporate dashboard will look like at your meetings. Next slide, please. I'm going to take you through a couple of key points. First of all, from an information technology perspective, there's a lot of work going on. We call it the bridge or CRM, customer relationship management. This is the foundation across which all of our programs talk to each other and talk to staff. It allows us to monitor activities, cases, and you can see from this slide some of the work in terms of releases of versions of the software that allows for this to happen that have taken place this year. And I draw your attention to a couple. First, the registration legislative changes, where we had to start measuring days and looking at how quickly we were processing applications. That came into effect, and we made changes that would allow us to do that and to be able to monitor that data, and I'll show you some in a moment. And on the right, you can see the e-portfolio that's mentioned. If we can have the next slide, please. The e-portfolio was a major piece of work over the past year, and it's allowed us to make some significant changes for the profession. This is the opportunity to collect continuing education activities from the profession. So there was some very significant work and some very significant consultations that happened to really understand what was working and what was not working. And a lot of people were involved, and I'll highlight Susan Taylor as the Director of Quality who really led this process, but many people from all departments, including IT, including the staff and QA, including communications, and on, were very much involved in development, testing, refining, and launching. And this has had some real significant outcomes to date. It is much easier to use, and in fact, I'm not sure if Susan coined this term, but it's about making it easy and then making it easier. So we're always looking to try to really improve that experience for the profession, because we don't want that to be a source of angst. We want that to be seamless. If we're asking the profession to send us their data on CE, we want it to be working well and easy to navigate. And then from a back end at the college, we want to be able to use that data. So I wanted to highlight that's a very significant piece of work that's happened, and we're continuing to monitor it, and we're continuing to hear from the profession. Some preliminary thoughts that I've heard is that with respect to the IT systems, and what I want to point out in this is the red arrow, where since January, our work to process applications as required by the regulations is under the legislative requirement of 15 days. So from the time that the application comes in to the time that we make contact with the applicant is required to be 15 days, and we are achieving that since January, and we expect that that will continue. This is a great example of a metric that may come off your list, where we're not going to provide this because we are living up to the expectations and complying with it, but I wanted to make sure you saw that. Next slide. And this is the second requirement, which is to have a decision that goes out to the candidate or the applicant within 60 days of a complete application. The dotted line is the requirement of 30 days, sorry, I said 60, 30 days. And the blue line is what we're meeting, what we're achieving. So we are processing completed applications very quickly. And again, it might be another metric that we don't necessarily provide here, but we watch it internally to make sure that we're staying on the mark. Next slide. From our facilities inspection program, and I won't spend a lot of time on this, but you will hear from Danielle Rodet later today to talk more generally about the program itself, just to keep you up to speed on some of the different work that we do around the college. When I started, there were a number of calls that I would get about a backlog in terms, more specifically, with the CT facility permits. What you can see on the slide before you is that we've dealt with the backlog. So all of those applications that were for provisional facility permit, or that had a facility provisional permit, they have all been dealt with. So that is fantastic news. The staff have been working extremely hard to make sure that we are looking at and making decisions about those provisionals. And we've actually converted them either to an annual facility permit, which is like a permanent permit, or they've been canceled altogether for a whole variety of reasons. But again, another point of data that may come out because we've actually been able to deal with the backlog. And I can't stress enough that what you're seeing on paper in terms of lines and dots, that has a direct translation in terms of how the profession sees the experience in working with the college and the things that we expect them to do. So there is more work to gather that information, but there is a direct association between this and the kind of feedback that we get and you probably get from the profession as well. Next slide. And very quickly, this just provides you with a bit of a snapshot, which I'll leave you with in your materials, that shows applications that are coming in to the facilities inspection program area and how we're able to process those as we move forward. And you can see that broken down by different years that those applications came in. And we're going through, as we did with PCRA, those that came in far back in terms of 2020, I believe, was the earliest year on this chart, and we're almost through that group, and we're almost through 2021. So we will continue to do this. The 2023 line, we're still in 2023, so that line's expected to go up, but we're dealing with these as quickly as possible now as well. And the final slide on facilities, this gives you a sense of the timelines that we're actually engaged with in terms of those complicated permit applications and those that are not complicated in the number of days potentially that it takes to deal with those. So again, a really important metric for us to be looking at when we're developing quality improvement steps within the department. Next slide. And the final points of data then are related to PCRA. And you've seen this many times, but again, really proud and happy to say that the achievement of the entire PCRA department in bringing down the numbers, the backlogs, the timelines has been nothing short of terrific. And you can see that there are 491 open case files, and this is a decrease of 17% compared to July of last year. So the numbers just keep going in the right direction. Next slide. And you will see here that we've now bundled 2019 to 2021, and we are almost through all of those cases from those 3 years, which, as you recall, was a significant number. You can see over 3 council meetings this year at the bottom of the slide. In April, we had 20% of those case files from those 3 years left, and now we have 8%, and we expect that by the end of this year, it will be under 5% that will be remaining. And some of those files are complex, so they will go on for a while, but the vast majority need to be completed at a faster rate, and the PCRA area and ICRC as the committee have done a tremendous job in making sure that that work is continuing. We also expect that the 2022 files will be under 10% by the end of this year as well. Next slide. So in my remaining minutes, just to give you a little bit of a sense of some other issues, some of this is in my report, some of it is not. We continue to see governance issues across the country. We're always flagging for different articles that might be of interest, and we've provided a few in my materials as links to some articles that are for your interest only. The College of Dental Hygienists will have its council meeting tomorrow. They are talking now about a governance review by Harry Caton and Deanna Williams. So that is just a theme that is continuing across the country and in Ontario. Our chair, Hanno, mentioned council engagement and looking at some different things that we can do in terms of more discussion time on various items and looking at our meeting structure next year and how we can accommodate the amount of work that you have to get through. And trying to make sure that we're really focusing you on the right things and allowing you to have the right information to make your decisions. The as of right legislation is a piece of legislation that was primarily dealing with moving services out of hospitals into communities, but there's a small section of that that relates to the ability of individuals from certain professions to come to Ontario and not have to register with their respective colleges. It will allow them to apply, and we're talking about 4: medicine, nursing, the medical laboratory technologists, and respiratory therapists. It requires them to apply to the college, but they don't have to be licensed for up to 6 months and still be able to practice in Ontario. This was a piece of legislation that raised our eyebrows around the regulatory tables in terms of how would this work. And there has been a resource document that I've linked to in my materials that allows you to see some of the work that's happening, that advises the colleges, the respective colleges, and the employers. These individuals will not be able to work in private practices. They must be employed or have privileges by hospitals or long-term care facilities. But there's still a number of questions that are outstanding, such as, will these individuals have mandatory reporting requirements to their respective colleges in that 6 months when they're not licensed? And the answer is likely no, because they are not a licensed member of the college. What to do with a patient complaint during those 6 months? The answer is the colleges won't be dealing with them. The institutions or employers will have to deal with those. So a lot of questions, and the reason that I'm keeping it on this agenda is this could come to every one of the 29 professions and 26 colleges in Ontario. So we are watching that very carefully. Next slide. In terms of our partners and collaborators, we spend a lot of time with our oral healthcare college colleagues. And we've done work, as you know, in the summer with respect to the COVID guidance document and rescinding that and doing that in a coordinated fashion. We're talking about the opportunity of looking at standards that we can make more consistent and aligned with each other. A good example would be IPAC, so more to come on that in terms of conversations. And we've looked at writing and have completed a joint article that we're publishing in various ways to the professions that will remind members or registrants of their obligations around mandatory reporting, because we believe that there are some registrants that aren't aware of their obligations as a member of a health profession. So we will be publishing that in various ways. The Ontario Fairness Commissioner has a great interest in the work that's going on at this college and all colleges. They are focusing on the national exams of dentistry, and they are looking at the experiences that are conveyed to the Fairness Commissioner's office from the internationally trained dentists. And we're working very closely with that office to make sure that we're addressing their questions at all times. And in fact, there is a meeting coming up, and I'm not sure, we're hoping December, but not sure if it will be that date or not. This will be the Federation. So CDRAF, for those who are new, is the Canadian Dental Regulatory Authorities Federation, which is all the colleges of dentistry in the country. So that board and registrars and the National Dental Examining Board and many of the fairness commissioners from other provinces will gather in Ottawa, and we'll spend time just really clarifying information about the exam and also answering any questions that they have. And hopefully there'll be the ability to walk through the site, which is a terrific examination site in Ottawa for dentists or candidates to dentistry. And the Commission on Dental Accreditation of Canada, there's a briefing note that I won't cover. There was some suggestion that the funding by all regulators in the country, including this college, would go up fairly significantly. A lot of conversations are happening right now as we speak, and hopefully I'll be able to bring you some news about an update on that in December or send it out between meetings. And next and final slide, please. A couple things around the college. This is just to give you a glimpse into some of the operational and communication issues. We have an upcoming RCDSO Connect. This is a webinar that we put on for members of the profession. We often get between 300 and 500 dentists who sign up and join, and we provide them with updates on counsel, and we focus on specific topics, and we've done almost like a record-keeping standards reminder to the profession. Very well received. November 1st is the next one, and we will have an individual who many of you met in May, Heather Watts, who will talk about the Indigenous experience in accessing oral health care, and we will have representatives from the NIHB for First Nations and Inuit communities to talk about the program that's available, where we hope that dentists will have a number of the myths or misinformation debunked for them, and more dentists will enroll in that program and be able to provide greater access for Indigenous communities and individuals. The Canadian Legal Information Institute, called CanLE, this is a website, and it's searchable and it's accessible, and it posts all of the decisions from the courts across the country and also tribunals like our discipline panel. We have added our discipline decisions now to CanLE. There's a very rigorous process to format the decisions, and so we've been working backwards, and all of 2023 is up there. We're working backwards soon to have 2022 and on and on. So that's a great thing, because now the decisions will be available very easily for others in Ontario and in the country to see precedents that have been set and to look at the facts and the decisions and outcomes of those meetings. I'm happy to say that you've had some conversation about all the standards that we need to address. We need to develop new ones. We need to refresh the ones that are on the books. And through the Finance Committee and ultimately through Council, there was approval for contract staff over a period of 2.5 years to really ramp this up, and those staff have been hired. So they've just started in September, and we're ready to go. So you will be having a lot more time spent in looking at actual standards, those that are in draft form and ready to go out for consultation, and those that are ready to be approved. So a lot of work is going to be happening in the next 2 to 3 years that you will see at this table. Our annual renewal process starts in a couple weeks, the second week in October. We've made some changes to the annual survey. We've taken out some questions that relate to things like service experience. We'll come back to that at a different time and in a different format. We've taken out some other questions that relate to areas like ownership, and we're adding questions to try to understand labor challenges for dentists in the province. So it's a really great opportunity for us to get 100% response from the profession and to really see some data that's timely and relevant to the work that we do and that others do as well. And final point about the Accessibility for Ontarians with Disabilities Act has been on the books for a number of years, and there are obligations to comply and to provide training for staff and others. There will be training that will be offered to council and committee members or required of council and committee members. That's to come, so stay tuned for that. Many, if not all of our staff have been through that service training, so we're ensuring that we're in a position to comply with every aspect of that act by 2025 as well. Next slide, which is just a question slide. So we can remove the slides, and I'm happy to take any questions that you might have today.
Judy?
Yes, thank you. And thank you for that, Dan. I have to say that it's, I don't know what you did differently this time, but it was a really excellent report. I did have one question around the different KPIs that you were showing us. And it seems to me that there had been long periods of time where the backlogs were just excessive and beyond what might have been considered reasonable, but that in a very short period of time, the college has been able to turn that around. And I'm just wondering, what, in your view, is the single most important factor that has led to these successes in shortening timelines? Because it's not apparent by just looking at the charts themselves.
We had to make it a priority. We had to mobilize leaders in the respective areas and staff and committees. I'm looking at Aaron because from ICR's perspective, there's been a tremendous amount of work that's happened in the last 2 years. And when it was made a priority and when the resources were provided, so we went out and we looked at how can we make sure that we're not adequately, but funding to a greater degree our public members who are going to be putting in a lot more time. How can we make sure that the budget is going to accommodate many dozens of panels that we'll need to meet? How can we make sure that the leaders can organize their staff differently? And once you make those things a priority and the expectations are that we will get this done, then there are many other elements to it, but it certainly happens in a way that even exceeded my expectations from a PCRA standpoint in terms of the amount of time that it took, which was quite short, to have some tremendous success in terms of these numbers.
Okay, thank you.
And I will call out Jill Slaughter, who is unable to, I don't think she's here, unable to be with us in person today, but is probably on the virtual screen, who has just done a tremendous job in that mobilization.
Thank you. Osama?
Thank you, Dan. That was a great presentation. Regarding the e-portfolio, have we thought of possibly collecting some data from that and making a connection with the standards that are being developed? So, potentially gathering some information regarding the CE, what type of courses people are doing, or what kind of courses the dentists are doing. And perhaps creating a connection with the standards that are being developed in terms of a priority.
Thanks, Osama. And I'll just start, and I know Andrea and Susan may also be able to offer. Yes, we've thought a lot about that. The e-portfolio is now designed in a way that will allow us to collect that data and really look at it in a very different way. And on a conceptual level, those are areas we absolutely need to move towards in terms of what is that data telling us? Are we driving registrants towards certain kinds of CE? Are they actually doing the CE that is relevant to the things that we're seeing? Susan, Andrea, you may be able to add a lot more to that, but that is absolutely how we want to move forward and why we not only develop something that would be easier for the registrants to navigate, but better for us to be able to start to really think about that data and how it's going to be used to educate, prevent, analyze, and align with the standards. Andrea?
Yeah, I'll just add a couple things, and Susan is really the expert in this. Susan Taylor, our Director of Quality, who's just behind me. But a couple things I would note, Osama, we have, I think, a huge benefit in that our standards work really roots through the Quality Assurance Committee. That's the home committee for that work. So that committee guides and directs staff on prioritization and drafts. So it's a really nice connection because they are also the group that looks at courses and e-portfolio. So we have that nexus there. Susan's been tremendous in collaborating with staff right across the college, but that includes the team that does the standards work. So we've been really thinking about all of those intersections and the possibilities to really leverage the data and experiences we have to inform our work. But I'll turn it to Susan because she's much more equipped and expert to talk about her plans.
Is it on? Okay. Thank you. Great question, and one that makes me very happy because we are absolutely looking at how we can use the data that we collect from members, registrants in their e-portfolio to start to see where are people engaging in continuing education activities. We have every single entry is tied to some sort of a competency, so whether it's a clinical competency or non-clinical competency, and that includes the standards. So we'll be able to analyze to see what people are doing, and then we'll be able to take that analysis to our Quality Assurance Committee, and we'll be able to use their knowledge to help us reach out to some of our partners like the university, continuing education departments, to develop courses in areas where there isn't a lot. So that will be one aspect. The other piece to it is the e-portfolio does have a space on its landing page where we'll be posting video vignettes about items that are of importance to dentists. And so we'll do that 4 times a year, and that will include, so if there was a release of a new standard, for example, there would be a very brief video that would identify the standard, what it's about, and identify some of the courses or some of the activities that a dentist might want to engage in to help them further their knowledge. And then the final piece to it is, as we move into next year, we'll be looking at how do we help dentists translate the knowledge to action. So if there's a course or there's an activity that they've been a part of, how do they take that and really put it into practice? Because that's one of the biggest challenges, as you can imagine. And so what are some of the tools, resources, checklists, algorithms, those sorts of things that we can provide for dentists to really help get some traction from those standards and help them put those into practice on a daily basis? So those are just some of the ideas. I'm sure we'll continue to evolve those over time. This is a very exciting time for us.
Thank you for that. I still have 4 people on my speakers list. Next is Daniel Haas.
Thank you. And yes, it was an excellent report, Dan. I appreciated that. As part of it, you did make mention of the CDAC funding issue, and I see that later today at 3:45, it's also on the agenda. Are we coming back to that? Because I can hold my question until the afternoon, or I can ask you now.
No, ask now. It's an information item. We weren't intending to cover it in any way, but happy to take your question.
Thanks.
now.
In the report, it does make mention of 2019, and it was a challenging time when there were changes and funding was withheld at the time. And if I read the report correctly, I think CDRIF is considering a 1-year commitment of funding at this time. And from the CDAC perspective, they're looking at sustainability. How can we keep functioning? And I think their issue, certainly in 2019, that was the issue. They couldn't keep going without secure funding. And I'm wondering, is that going to be a problem if they don't have funding for more than 1 year? Can they keep their operations going? Can they hire the people they need? Can they plan for accreditation site visits for next year when they don't know if they'll have the funding to do it, et cetera? Which is why I'm speculating that's why they're asking for a 5-year commitment. So could the 1-year commitment be problematic, is my question.
Yeah, so I think, I can't speak for CDAC. I don't have any indication that they can't fund or plan for site visits next year. What CDAC has been trying to do is stabilize funding. You're absolutely right. And I think what CDRAF as a federation does not fund CDAC. Every single regulator funds CDAC. So we pay currently just over $250,000 to CDAC, and we will pay, with the new scheme that they've proposed, over $400,000 based on the current membership numbers, which is a huge amount, and there's many different ways to set up accreditation organizations. And I think what's happening at the national level is the three federations, the dental hygienists, the dental assistants, and the dentists, have been talking about, as funders, we fund over 75 to 80% of CDAC's budget. And we're looking to have more conversation about areas that are important to us as the regulators, who are one of the recipients of the value of CDAC. And we're trying to create that understanding of what the value is and what we want it to be. So we're not looking to put CDAC in a bad spot on a year-to-year basis, but we're also not prepared, I think, as a college, and we've had some conversations at exec and as federations, to provide a 5-year commitment until we have more understanding of what that value is going to be. I'll give you one example. There's no transparency of the reporting, and the regulators across the country have said that there should be, and so we're focusing on that as one aspect, but there are several others as well. It's not my intention or any intention I've heard from any other registrar to put them in a bind where they can't do site visits, but we want to press them more to do more for us.
Okay, thank you. It's helpful to know.
Thank you. Jamie?
Thank you, Dan, for the report. I was mostly interested in the content in Connect and how you prioritize what content goes in there. That's question number one. And this is most likely going to relate to this afternoon's discussion or later on today. How much information about PLP is out there to the dentists? As current chair of the PLP, it comes to my understanding that if dentists don't actually have a claim or a reason to have a claim, they don't know that much about the program. And I understand Alan Chappelle and Peter Hong go out and talk very regularly, but how much real information on PLP is available to the dentists? Thank you.
So I'll address your second question, and Leslie can address the first question about RCDSO Connect. It's hard for me to quantify that. PLP has its own website. There are materials that are available on our website. So much like information that we have about the college in general, there's information about PLP in general. But there are lots of individuals that never have to intersect with the college or PLP, so they may not pay attention to it on a regular basis. So it's available, it's out there. Can we be more active? Always we can be more active. But I've heard a lot of information out there about PLP and the college that is not accurate. So it's a never-ending challenge to be able to provide that kind of information to a group of 11,000 dentists on a regular basis that's current. But that's why Leslie and team are always thinking about and really advancing. And one day we'll talk about communications and a lot of the activities that are involved in that department, because we've done over the last couple of years a lot more in terms of trying to advance communications across several platforms. Leslie, do you want to address the question about RCDSO Connect and anything that I may have missed on that?
Thanks, and thank you very much for the question, Jamie, because that's certainly something we've been thinking about over the last month or so, is hosting an event later this fall out of our discussions today about PLP specifically, separate from the Connect sessions, because I think you're correct. The more information, the better. And it's a terrific way to reach the profession in a time that works for them. As to the determination of how we decide what's going to be on the agenda, it's connected to a number of things. One, what patterns that we see in terms of things like the need for record-keeping courses, which is kind of ongoing, so that's kind of a regular feature and a good one. And what's happening in the college, which is a usual feature of these events, what the priorities of the strategic plan are, and the one coming up in the fall relates to the priorities around EDI. So we're very excited about that. So that's how we decide what's coming up next. Thanks, Jamie.
Thank you. The next item on the agenda is fairly lengthy, but I'm aware I still have two speakers on this list, so I'm going to go to them, and I'm going to ask you to be as brief as you can in your questions, please. To the registrar, the first one is Rod.
Thanks very much. Dan, a good pitch, good data. Listen, this may have already been mentioned, and it's regarding the e-portfolio. Is it intended that the portfolio evolve, if not already planned to do so, into a two-way communication with our 11,000 dentists to provide notifications of status of education? I think that was already mentioned, but it also could provide triggers or notifications of impending actions expected of them, related to PCRA actions or discipline committee actions. I raise that in that because in past discipline committee events, we've had incidences where college notification was less than optimal, I guess, of our expectations of them. And I wanted to see if this would be a great tool to do a two-way trigger to keep everybody up to date.
Thanks, Rod. I'm going to pass that over to Susan, please.
Okay. Okay, I think I'm on now. So it's a great question. The e-portfolio really is focused on the educational components. We are building the ability to send reminders to people in advance of their deadline for earning and reporting all of their credits. So prior to their approaching deadline, they'll get a message from us saying, we notice that your deadline's coming up and you still need to earn X number of credits in this category. So we'll be doing those sorts of communications with people. We'll also be engaging in communications like reminding them that there's an RCDSO Connect session coming up, or where they might go to find e-learning sessions, that sort of thing. I don't think that we will be able to use the e-portfolio from the perspective of notifications for PCRA committees because of the separation of quality assurance and the other business of the college. So I think that we will need to keep those separate, but we will try to reinforce as much as we can. And I know that there has been a lot of work done with the registration process about reminding people to be sure that they've kept their email addresses up to date and those sorts of things.
Thank you, Susan. And last speaker on my list is Nizar.
Thank you, Mr. Chair. I have both a comment and a question. Firstly, it's probably a follow-up to Judith's comment about the kinds of changes that we're seeing. I've actually not seen, excuse me, reactive statistics such as this for a very, very long time. And so on that basis, I'm reminded of Peter Drucker's, you cannot manage what you cannot measure. And so I actually wanted to, Mr. Chair, with respect, congratulate our CEO and registrar along with the entire team and acknowledge my colleague, Nancy DeSanto, for her leadership over the e-portfolio team. These are remarkable results. They give great confidence to the council, and so I wanted to, for the purposes of the minutes, actually acknowledge that. My question is if there are future plans to generate comparative statistics with other provinces. I think that's a great way for us to learn, whether from Quebec or other colleges, in terms of some of the work that they're doing that we could either collaborate on or learn from to continue to see these remarkable achievements.
Yeah, so I'll answer briefly in two parts. We are always learning from other jurisdictions and other colleges, and I think that would be certainly my message to all of our leaders and staff, that every day we should be learning about what's happening out there, because it doesn't matter big or small in terms of the college. There is a lot of really creative work that's being done and a lot of things that we can learn from all of them. In terms of comparative statistics, there is a framework in Ontario, the College Performance Measurement Framework now, that the ministry has worked with the regulators on to require us and allow us to provide a lot of data across standards that are important to be an effective regulator. There's no comparator or comparison process yet on that, but there are 26 reports that sit on the websites of all the colleges across the standardized group of measures. And you can look at them, well, not you, but we can all look at them, and we can draw our own conclusions. Sometimes the context is very different, even though we operate under the same legislation. But Nazar, to your point, I think we're always trying to learn from others, and we're trying to measure and come up together with what are the right measures that say we're doing the job that we're supposed to be doing.
Thank you, and thank you for your comments, Nazar. I would just also please ask, once you've asked your question, if you could lower your hand so that I'm not adding you to any list. Next item on the agenda is a significant one for the future of the RCDSO. It concerns the Professional Liability Program Expert Review Task Force Report. The material for this item is on pages 81 to 161 of your package, and this is an item for decision. Included in your package was the final report from the task force, as well as a briefing note with further analysis of the options. Some of you will recall that the Expert Review Task Force was launched in December of 2022 on the recommendation of the Audit Committee, now the Finance, Audit, and Risk Committee. The task force was asked to review the college-operated professional liability program and to specifically identify benefits and risks related to the program with respect to the college and to the public. They were also asked to identify ways to mitigate risks where possible. For today's discussion, you are being asked to consider these benefits and risks to decide on the future of the professional liability program with respect to the college. In a few minutes, you will hear from the registrar. Dan will walk you through the process undertaken by the task force and their report. We will then hear from Finance, Audit, and Risk Chair Mark Eckler, and then we will have our full discussion. I will be keeping speakers list throughout, so let us begin the discussion with some remarks from Harinder. Harinder?
Thank you, Hanno. Council, this is an issue of great importance to all of us. The report was an excellent and thoughtful piece of work. I want to applaud the authors, who include two former council members, Sandy Venditti and Joseph Richards. The task force brought great expertise to this process. They all possess regulatory and malpractice liability provider expertise. Each of the members also has experience in the intermingling of regulation and liability. I think the task force has done an excellent job in framing the benefits and risks. Staff have provided an in-depth analysis in the briefing note that you all have. As we hear from Dan, and as we discuss next steps, I urge you to consider the report and the decision we ultimately make with respect to our public interest mandate. While many of us are members of the profession, we must not become advocates for the profession as we consider this issue. I know this is a significant strategic decision that we must make as a council, and it is important that we make our decision as our roles as governors of the RCDSO. That means this decision is about an analysis of benefits and risks and what the college is prepared to accept for our future. Now, Dan's presentation will give you further context. Dan, can I hand it back to you?
Thank you, Harinder. And if I could have the slide deck. While the slide deck is coming up, I want to introduce Margot Orchard, who is back there and can wave. Margot has been the project manager on this work since January and has really allowed us to stick handle a very complex set of issues, working with the task force, who were terrific, and also in pulling together a report that is thorough and obviously comes to you from the task force, but Margot had a great hand in making sure that that was all completed. What you have before you are two things. You have a report from the task force. Those are the words of the task force. They have signed off on that, and there's a letter you can see in the front of that. And you have a briefing note that is further analysis that we have done as senior staff that allows us to really drill down further into some of the options that we'll talk about today. And I want to take you through this in a fairly comprehensive way, because it does involve a lot of issues that you won't necessarily deal with in your day-to-day lives. And I know that when I started, I came to this college as a regulator, a career regulator, and certainly had not very much not any direct experience and not very much indirect experience with the malpractice side of the equation. So a lot of learning has taken place by a lot of people over the last 3 years in my time. And I will walk you through, and we'll have lots of time for discussion, and we want to make sure that your understanding is as high as it can be. Next slide. So the purpose then today is to really get into the background. Why did we do this? To look at the report itself and the options that have come out of that report. And also to look at some next steps. Obviously, that will be dependent on your direction and your discussion. Next slide. So why did we do this? There's a number of reasons, and we've highlighted a few here. First of all, there are very few health regulators in Canada who are directly operating this kind of program. There are some. There are none in Ontario in terms of health. And there are a couple that you will have seen within this report as well, such as the College of Dental Surgeons of Alberta recently started a comparable program within the last year and a half or 2 years, and the Quebec College that operates a program. And there are differences in all of these programs, so I don't want any of you to think that they're all the same and we can compare apples to apples. This program, RCDSOs, was established in the 1970s, 1973. And it was determined in that day that there needed to be more accessibility to this kind of protection for patients and for the profession, and that it needed to be inexpensive. So I don't know if some of you were around at that time, but those were the drivers at the time that are written down in various documents. And to my knowledge, as I've studied this over the last 3 years, there is no study that I've come up with where somebody has stepped back and said, how does this work within a regulator? What are the benefits and the risks? I haven't been able to find that kind of analysis or approach. And I want to be really clear that this is about the interaction of a malpractice arm with a regulator and the duties that both of those entail. This has nothing to do with how the PLP program in its current iteration is operating. It is effective, it is efficient, it is doing a fabulous job. The staff come to work every day and they put in the effort to make sure that they're achieving the goals and the outcomes that we would hope for a program like this. It doesn't have anything to do with that. It has to do with how these tensions are navigated between the public interest mandate and protecting dentists with a malpractice arm. And we've had some negative attention on that. I don't want to say that it's been frequent or every day, but you can see that there has been some media that's followed this and has really asked those same questions. How do you do this within the same organization and justify that you are protecting patients at the same time that it appears that you're protecting dentists? There's also changing expectations of us as institutions, as regulators. Patients are more vocal, as they should be. Social media allows messaging and positions and whether it's real or perceived information to travel very quickly. And so the expectations and the ability to communicate has changed dramatically in the last 10 years. And finally, the RCDSO's own audit committee, at my urging, started to look at this about a year and a half ago and came to a point where it said, we just really need some more expertise and some experience to really dive into this. And so next slide, please. That was when the audit committee came here last December and council approved the formation of the task force. And over the month or so after the December meeting, this group was put together. And so you have heard reference to the two individuals at the bottom of the list, Joseph Richards, who's a former public member and a former chair of PLP committee, and Sandy Venditti, who's a former council member and former president. So representing the dentist community and understanding clinical practice and also the college and the regulator. The top four individuals have stellar reputations and credentials. and they have their foot in the different sides of this. So they're part of the Law Society and Law Pro, or architects, or the Canadian Medical Protective Association. The CMPA is not a regulator. It's an independent mutual defense organization, but it, by the nature of its work, it defends doctors who are undergoing civil actions and also regulatory actions. So it does understand the regulatory world, and the individual came to us with a lot of experience in that world. On the left side, you see the purpose. It was really to review the current program and understand it, to make recommendations about what those risks are and what the mitigation solutions would be, and to develop an implementation plan. And I'll tell you now that the implementation plan you don't have, because we need a direction. And I'll talk a little bit about how this task force approached its work. Next slide. So I won't go over this in any detail, but they were able to organize their discussions, which occurred over 6 months. They held 6 half-day meetings with lots of homework in between, and they were looking at understanding the current landscape and the program, really diving into the risks and the benefits, and really trying to understand what they meant, both to the college, to the public, and the profession. They looked at other models, which are in the report. They identified some options for you. They looked at what are possible mitigation strategies for each of the options. And they started to think about implementation, but as I mentioned, they weren't able to go down that road too far. And they came up with a number of recommendations, which are essentially recommendations to say, if then. If you do this, then you might expect this. They weren't a recommendation to this council. And again, I'll mention that as we get towards the end of this presentation. Next slide. I would urge you to think of this as the task force contemplated it. This is about the benefits and the risks that's based on the public and patients and the college as an institution, mostly the public and patients. This is not about dentists. We can acknowledge, and I will acknowledge, and I will talk about a lot of the benefits that come to dentists by the way the program has been structured, but our framing, your framing of this needs to be with respect to the public and the patients and the risks that may be incurred as a result of this tension that I spoke to. And there's the words that are in quotes on the left that I say many, many times. That's one sentence from our act, which is quite clear. In carrying out its objects, the college has a duty to serve and protect the public interests. And so we can acknowledge that assuring dentists that all dentists have malpractice protection is of benefit to the public and patients. But we also have those risks that I'll mention that lead us to operate in a very unpredictable environment with issues that relate to our mandate and reputation and regulatory requirements. Next slide. So I'll comment here on the benefits, and some of these you've heard recently. You've had some orientation around PLP. Access to coverage is the first, and that relates to when you get licensed here and when you renew, you automatically have access to this program. And that means that we don't have to do any audits or compliance. The 25 other colleges in Ontario, they expect a certain minimum amount for their membership, and they will go out and do random checks in some cases, and they'll make sure that the members have their malpractice insurance up to the level that's expected. We don't have to do that. We are able to provide that with the license fee. The ease to the public is there because they know that there is going to be the backstop if they have an issue. And there's a payment, whether it's in a settlement or an award. So that's going to be something that sometimes will not have the same kind of adversarial approach that you might have with members of the profession who are involved in commercial insurance products. And that we have some influence, not all influence, but some influence over how the program runs in terms of possibly leaning more towards payouts in certain situations. But at the end of the day, the program is there to ensure that the dentist's rights are protected. And so there will be adversarial processes, and it will have dentists versus patients. And that is not then an environment that is patient-friendly necessarily. So there's influence to some degree, but obviously that program is there for a reason. I'm going to spend a bit of time on risks. And before I do that and go to the subsequent slides, when the task force looked at the analysis, risks are generally looked at with objective data and in oftentimes subjective or value-based data. They're looking at it from the inability to quantify, but based on experience or expertise that they bring to the table and a collective conversation about what they think this means. So you'll see some visuals. They won't have numbers because it's really challenging to quantify. Financial obviously is much easier. But when you talk about reputational and regulatory risk, it's not easy to come up with numbers. You could apply arbitrary numbers based on where you think something fits on a spectrum, but they brought their collective wisdom, experience, and expertise to this exercise. Next slide. So I'm going to start with reputational risk, and what I mean by that is essentially the trustworthiness of the college, or what is seen to be the trustworthiness of the college and our integrity, and how external institutions and individuals would look at us as an entity, given all of the different factors that they know about. And when you think, as I've said, about the regulatory mandate of the college, it is to protect the public, and the PLP mandate is different. So our task force looked at this in terms of the probability, and they based this on experience. So we know that the college, this college specifically, has had criticism that is related to how we operate that program within our mandate. We know that there's growing mistrust in regulators, and we've seen that with, I talk about governance reviews, and that comes from the place of regulators not seen to be doing their jobs, and it starts at the top. And so we have to factor this in, and I know when I've talked to different groups over the last 3 or 4 weeks, this is one that's harder to wrap your minds around because it's not quantifiable, but it has real implications. There are real costs associated with risks that might be realized. So there may be costs because you have to step up your communications game and be more strategic in your communications. You might have to explore crisis management situations, and that might involve experts in crisis management and experts in government relations. When the public and the profession lose confidence in an institution or a regulator, that has a real impact. Some of it may not be easy to measure, but the profession that doesn't trust its regulator or loses respect for its regulator is a real problem. It's a real challenge. You know, we're not here for the profession, but we rely on the profession to carry out the expectations that will be of benefit to patients. When patients lose trust or the public loses trust, that can have a real impact in terms of whether they decide to come to the college with their concern or their complaint. And if we don't have people coming to us with their concerns or their complaints, and that does happen, and you see that in looking at various social media messaging that can happen around individual circumstances, that's a problem for a regulator if we're not seen to be doing the job that we're actually here to do. And at a very extreme end, the ministry has the authority to appoint a supervisor over any regulator or health regulator in the province. We have seen that. In 2011, we saw that the ministry appointed a supervisor to the College of Denturists. So it dismissed the entire council and the registrar and CEO and appointed an individual supervisor. I'm not suggesting that that happens frequently, but when there is this sense that the college or the governors are not doing the job that they are supposed to, when there is an issue that raises red flags and gets perhaps blown out of proportion or has some meat to it, there is the authority of the Minister of Health to appoint that supervisor. So there are obviously real costs that are tied to reputation. And the impact on the college integrity is real. It can be perceived and it can be based on misinformation, but it is actually real in terms of the impact potentially. Next slide. And I will take questions at the end, and we'll have a break as well. Regulatory risk is more about, are we doing our job? And I've talked about the duty, and our duty includes being able to address where there may be incompetence at play, where there may be professional misconduct at play. And we know that from a PLP side, that information is kept confidential for a variety of reasons. But you are potentially faced with a situation where PLP is dealing with an incident and the individual may not be competent. And that information under the current environment cannot be shared, is not shared. So what does that say about the regulator in terms of that friction and having a department that's doing that? And again, it's not about how they're doing their work, it's about the placement within the organization. The question came up at the task force, should the college be automatically informed? There was a lot of debate about whether moving information out of PLP under some circumstances to the rest of the college would obviously be seen as a positive by some stakeholder groups, and it would be seen as a negative mostly by the profession. Is this a safe environment? I come to you with my concern, I need to have your protection, and now the information's going out of this confine. So again, it's a real issue that we have to think about in terms of the organization and the risks that may be involved. At the end of the day, the RCDSO owns PLP. So how will can the public separate out the fact that we've firewalled these programs, we've put in place separation, but does the public understand that? Will they believe it? And how far can you go with separation before they start to believe it? And we just don't know those answers, but they're very real issues. And I've mentioned about the profession potentially losing trust in PLP as a safe haven if there were certain measures put into place. The other aspect that the task force talked a lot about was we had lawyers and architects, or at least individuals that are representing those organizations at the table. There was a sense that healthcare is different from other non-health professions because of the harm that can occur to people, real harm that's physical. So while the risk assessment may look, in a certain way with how the Law Society runs Law Pro, or how the architect regulator runs Pro-Demnity, but for a college that is involved with health professions, that risk assessment can change because of that harm. So another factor that was discussed quite extensively. And as we talk about the finances and the inevitability, I would say, of the cost of PLP increasing, does professional choice of the provider matter? Do they start to think about whether they're able to get this insurance or coverage elsewhere if our costs continue to climb? So again, all of these factors went into what we've bundled into the regulatory risk. Next slide. Financial risk is somewhat different in that I will say the assessment of the risk right now is the assessment of the risk right now. And this can be changed probably more readily than the other two because there are ways to de-risk. There are ways to manage the finances. There are ways to get money from the profession that will fund reserves. But there are many ways that we can manage this particular risk that are more immediate, but not losing sight of the other two. So right now we have the college's finances, which includes PLP, so it's all part of the same financial statements. We do not have protection from the regulatory assets. I'd say that it's played out in the last few years in terms of trying to build our operating reserve in the reality of having underfunded PLP and trying to catch up with that at the same time. And how much can you go back to the profession as the college to say we need money for these things? And oftentimes that I've heard, it's tied back to, well, the regulator's just asking for more money, and we're trying to communicate more that there are two aspects. But all of these finances are together, and the assets of the college in the current iteration are not necessarily protected from claims that could happen. We've had unpredictable results, so you've heard in some orientation about the concept of loss provisions. We've had surprises in terms of what we must add to the income statement, which increases expenses and creates deficits and sometimes quite significant. We've managed to manage that better with the increase that took place last year of about $485 to the profession, but there are still a number of other issues and concerns. And so they, as I've said, they've looked at the probability and they've looked at the severity, and that dot is where it is because of where we are currently, but not necessarily where we would need to stay if we made some changes to the finances, but it wouldn't necessarily look at the whole risk platform holistically, which is what you're being presented with. Next slide. Some additional financial information that came in after the task force finished its work, and this is related to the reserve that we keep to fund those extreme claims or situations where we have a reserve of $22.5 million that is reserved for PLP. It is not used for other activities. It's used to ensure that we're protected on those 1 in 50 or 1 in 100 year kinds of claims that we might get. We have heard from our actuaries that our reserve is likely low based on our current reality, and the recommendation is to go to 41 million, up from 22. We could also make that less, and it could be 29 million and still be an acceptable amount based on their actuarial analysis. But that money has to come from the profession. That money has to come from the surpluses that drive the reserves up. And that is something that was presented to us after July 31st, or on July 31st, but after the task force had finished its work. If you think about the adequacy of the insurance policy, and we have $2 million per occurrence coverage up to a $10 million aggregate, and then the insurance policy kicks in for the next 20 million, that we could increase that. So we can always make changes to that. The premiums would go up, the costs would be higher, but there's certainly ways to address that. And we can address significant events through a levy with the membership because we have the ability to charge a fee every single year. I know the Law Society had a situation where they were underfunded by $200 million back in the 1990s. And so they went out over some period of time to collect the money from the profession, essentially, which was probably quite high. And I don't think it wasn't 1 year, it was over a period of time. But they were then able to think about that offering and make a number of changes to their program as well. And as I said earlier, the last bullet on the right, I would suggest to you that increasing fees to the profession for this aspect of the work currently, the increase is inevitable. We have the reserve issue. We have the unpredictable nature in the way that the program is structured with the current thresholds of coverage. We have the need to cover the operating reserve, and as I mentioned earlier to Nazar's question, the College Performance Measurement Framework requires us to have a reserve at minimum 25% of our operating costs, and we're $5.5 million short. We will have to think through how to cover all of these different aspects fairly quickly, and obviously dependent on your decisions or directions with PLP. Next slide. The task force spent a lot of time thinking about other models as well. We had some people around the table who were from these organizations, and we had others that came in and presented to the group. You can read more about the various programs, and we can try to answer your questions as best as we can today. But I think there were some themes that emerged that as we look to these different programs, you can't compare apples to apples here. Every program is different, but most had independent subsidiaries. So they didn't operate them as a department within their organization. Most had independent governance. The Quebec College has just had legislation that actually disbanded the board of that separate arm, but most have a separate board of directors for that activity of the malpractice protection. They have some degree of college oversight or influence, but again, you can make decisions in terms of how much separation you want with the subsidiary corporation and what the board looks like and the governance decisions. And there's a spectrum of what any organization could do in separating those entities. They've all separated their finances so they don't commingle. In the Quebec College case, the FARP ODQ, they have legislation that allows them to report individuals where there's some concern, there may be incompetence or professional misconduct. That is through legislation. That was not a decision that was made by the individual program. They had to have an act that allowed that to happen. And the final point is all of them have legislation authorizing these programs. So this is a non-legislated activity for RCDSO. But all of these 4 programs that we looked at have legislation that says they can operate these programs. It doesn't say they have to or they're obligated, but there is authority to do so. Next slide. So in terms of options, I'm going to take you through the three options that were presented by the task force. And they range, as you can see, from status quo on the left with minor tweaking to fully divest PLP from the RCDSO, meaning we would, as an institution, we would no longer directly operate it. And it was seen to be that there are many nuances within each, and I'll talk you through some of them. But these are the three major ways that the college could move forward in recognition of the benefits and the risks and how you assess those based on where you want to go. Next slide. So I'm going to start with status quo. And the task force talked about the modifications. So we learned that we could have a different terms of reference for the PLP committee. There could be a greater separation of PLP committee from this council, because right now you don't have membership on it other than Jamie, who's the chair, and that was intentional to have it as a public member, not a dentist, and then have complete separation from this council. And you could look at that to do something further, but it would still be a committee of the college. Separate the finances to a greater degree, revisit the insurance coverage, maybe pay more premium for greater coverage. Look at differential premiums. What's the risk profile of dentists? You could look at the ones who are activating the coverage more than others. You can look at higher deductibles. We've talked in orientations sessions about the data that some of it's there, some of it we could build, we could educate more, we could evaluate that education. None of that would change the risks that have been presented. It would help the program, no question. It would probably bring a lot of benefits to dentists. It would probably bring a lot of benefits to the college. It might bring benefits to patients and the public if there's actual changes in practice. But it wouldn't take away from the some of the other risks that have been identified. And those are the words of the task force. So from the public's perspective, we would still own the program and still operate it, and you'd still have the tension and the conflict. And from a financial risk perspective, if we didn't address the issues that were referred to earlier, then we'd still have some of those issues. But again, those are the easier ones. So the key considerations are that you would retain the current program. So you've heard about benefits that the program offers, so you'd retain that. These are big changes that are in the subsequent two options. So you wouldn't have that management of change that would be required in going with this option, but you wouldn't address any of the risks either. And again, what I'll say at the end is it's about your risk appetite. What are you prepared to accept and what are you prepared to defend down the road if something were to be realized? And that's generally the question that you'll have to address. Next slide. I'll turn now to the subsidiary corporation, and this is about creating separation. So again, you can do that in a number of ways, but the task force thought that one of the cleanest ways that seems to be a solution that others have used is creating a separate entity. Separate corporate entity, you have a different board of directors, you hire a senior person who's a senior person from the insurance or the risk sector, you fully separate the finances and you create it that way. Startup costs are just over $1 million. The reason for that is, well, there's a lot of legal and audit and accounting costs, but we also would have to disentangle a number of things. Probably the greatest cost would be information systems. Not that the information systems are allowing regulatory staff to look at the PLP information, but because they're all developed together and they're common platforms, and there'd have to be a lot of disentanglement of that would occur. And then the annual operating costs, depending on how you structure it, could approach $1 million. These are numbers that were created by talking to various experts to see where we would be. Obviously, there'd have to be a lot more analysis on this before we could tell you exactly what it would cost, but we wanted to bring kind of a quantum that would help you. The impact on the college would also be there because we have a reserve, which means we have money that's been invested, and those investments are part of the college because it's all one. So there would be an impact. The fees for PLP wouldn't come to the college. It would go to the subsidiary corporation. So there are a number of financial considerations, pros and cons as well. In all of this, in this option and in the next, the staff are the priority. We have 20 staff, as you know, and we want to make sure, and I've spent a lot of time over the last 3 weeks talking to them. I wanted to make sure that they were fully aware of this report, what it says, what we're thinking, no direction, and questions always come to what about us? And absolutely understandable, and we want to make sure that whatever council decides that we have as a key part of our consideration and implementation plan, how do we manage that very important aspect? Increased separation from the college will provide much greater risk mitigation, but it may not be seen differently. So that was the concept of the task force. Like, you can create the subsidiary, but are you actually going to achieve what you want to achieve from a reputational side? And the public doesn't drill into these issues like you do. The public just relies on the quick information and forms opinions and conclusions based on that. So that could still remain. The college assets would be protected in a much greater way with a subsidiary, but as we've heard from a preliminary consult with legal counsel, it's not a guarantee. And so we'd obviously want to make sure that there was a structure that would allow for that to be close to a guarantee, but you can never have that with these structures, although it would be significantly improved over what we are looking at today. And we would have less influence. You know, you have an independent entity that's doing its work. That would mean that you as a council, or we as a college, or I as a registrar would not be able to tell them what to do necessarily if we saw some things happening that we didn't like. So that influence would decrease as well. Next slide. And the final option is related to not directly operating the program at some point in time. And this is an option actually that has evolved since the task force met. And they were certainly looking at it in a very thorough manner. But I think there have been some other suggestions that have allowed senior staff to perhaps think about some different ways to approach this kind of direction. So first of all, you could sell the book of claims, and then the program is done and somebody takes that on. And there's all sorts of intricacies with that. You could wind down the program over time. You could say at this point in time, and you'd have to give a lot of notice, we will not take inquiries to the college or to the PLP program, but we'll deal with the claims that we have until we get that down to a more manageable or much lower level. I think the other option that hasn't been explored as much is really thinking about an organization that could take this on. There are some organizations that might be interested in talking about this, but there's nothing that I could present to you today about that. But it would help to potentially preserve some of the benefits, some of the benefits that have been accrued by PLP in its current iteration. And it would also look to things like, what about staff? And what about, how this program is structured for dentists, because it understands the clinical environment. So there are some, I think, some unique opportunities to explore. It's not, I don't want to leave you with the impression that this is an option that shutters the doors and the windows. There are so many ways to do this and so many ways to explore it. And that's something that I'll leave for your consideration. Depending on the option, we don't know the costs. It would be variable depending on which way we went. But again, under key considerations, staff are the priority. And we need to consider that at a very high level within the implementation plan. As one of the task force members said, if the college wants zero risk, you don't run the program. Any way you run this program will have risk. And we deal with risk all the time. Every program that we have has some element of risk, but that was certainly a comment that they suggested to us. And we'd be consistent with other regulatory colleges in Ontario. We'd expect certain minimum coverage of the profession, and we'd look at ways to ensure that that is happening. And as I've said, there might be some other financial effects on the college, but again, you have a plan to deal with that in some responsible way. Next slide. I won't cover this in any great degree, but this is all about your risk appetite. What are you as a council comfortable with in hearing from this group of individuals who've lived in this world and have tried to assess where they think we are and tried to assess what they think could be possible solutions? What's your level of comfort with moving forward? And so it's looking at the mandate, the public protection mandate, looking at the elements of trust, looking at the finances, looking at the relationships that have been built. I know that there are some dentists who enjoy the fact that they can come to PLP and get that coverage, and there are others who don't believe that we should be running it. So it's hard to base decisions on that kind of perspective that varies across the profession. But respectful relationship also includes things like being transparent, being open, talking about decisions that need to be made, decisions that have been made, and why. Next slide. So I think it's the second last slide, but just to really important considerations as you start your discussion. You must decide that risk tolerance, as I've mentioned. And really the questions, can you have a level of comfort that you can operate PLP of the future without impacting the public interest mandate? And so some have said, we've run it for 50 years with no problems, so what's the concern? I would push back on that and say, there have been challenges along the way. There have been challenges that you can see from some of the media exposure. There have been challenges with finances. I can't tell you what happened in the 1970s or the 1980s or the 1990s, but over the last decade or 15 years, the time that I've been here, there are lots of challenges. So it's not like it has not had its share of issues to be addressed. So it has operated for a long time. There are many reasons to think that it's been successful, but there are also things that have been addressed along the way. Will the decided course of action make us more trustworthy as a college in the eyes of many of our interested parties? Will the profession accept that increased fees are palatable without having choice? Does the assessment of risk change because it's a non-legislative program or because it's a healthcare program? And I just wanted to leave you with those questions so that you're considering this in as thorough a manner as possible. Next slide. And so what's happened in the last 4 weeks or so is I've spent a lot of time with others and talking to PLP staff, talking to college leadership, sharing the report, sharing the options, being really clear about what the options are for your consideration, being clear that nothing's been decided, committing to being open and transparent as we move forward, and talking to the PLP committee and all the staff. The Finance, Audit, and Risk Committee, and you'll hear from Mark Eckler in a few moments, talked about this extensively on August 14th. The executive committee had some discussions about this. Obviously, the exec didn't come forward with any conclusions or recommendations. That's coming to you from the Finance Committee, and you're here today. And the based on whatever direction you decide and when you decide it, we as staff will develop a full implementation plan that you will see. And it will be, in some cases, exploration of maybe different options, and as much detail as we can provide that will allow you to really solidify whatever that decision is for you. Next slide. So I will turn it over to Hanno, and we're going to have, I think we're going to have a break, but I'll leave that with Hanno. You're going to hear from Mark talking about the Finance Committee, then you're going to have a discussion. And we can certainly talk about whatever information that you want clarified. Want to know your thoughts on risk tolerance. We want to do a straw poll just to see an anonymous straw poll with status quo, subsidiary, divest, don't know, and see where we are as a council, and then see where we land by 11:45 or 12 o'clock. Hanno?
Thank you very much for that, Dan. So, Council, just to give you a little bit of a lay of the land, I mean, we are looking at approaching a break. The break is going to be about 10 minutes. I have a few minutes that if you have questions, so this is not a time to offer opinion, this is not a time for discussion, all that will happen after the break. But if we take a few minutes now, if you have questions about what you heard from Dan or something that you feel you didn't fully understand or needs a little bit more information. So I'm going to start with you, Daniel.
Thank you. Just quickly, I want to commend the council for moving forward in this direction. I thought the task force report was excellent. My question, and I'm trying to decide, and this question may only reflect my own lack of knowledge of this area, but in looking at and trying to compare the subsidiary model with the full divestment model, I'm wondering if the full divestment model might result in a potential risk to the public, in that could the new insurers, private insurers, make a business decision that they're not going to cover certain high-risk procedures because it's not in their financial interest to do so. They either don't cover them or they charge premiums that are not realistic. And therefore, those dentists or dental specialists who do these highly complex, risky procedures stop doing them. And as a result, the patients who need them now have nowhere to go. So is that a possibility?
I think it's a possibility. I think it relates to what model is ultimately selected in terms of not operating it directly. So if the model is to say that dentists are on their own, they must go out to commercial providers or whatever providers are available, that could happen. If the model is an organization that says we're willing to consider taking this on and operating it in a similar manner, and they're familiar with the dental environment and clinical practice, then again, it's possible, but it's a totally different scenario from the first one that I mentioned. So again, it really depends on how we think about that moving forward, and what we're saying to the profession in terms of where are you going after this. And the question from the profession that I hear is, well, okay, who do I call now? Well, you still call us. Like, we're not talking about days or months. We're talking about a long period of really exploring what this needs to look like.
But could the subsidiary model address that a condition could be that you can't do what I just suggested, and even though it's still distinct separation financially, et cetera, there's some more control that we're making sure the malpractice insurance is still set up so that the public is protected?
So I would say, and I don't want to get into too much of a legal conversation. I know Sarah Yoon is here from Weirfold. I think you could have that risk with a subsidiary, because you can control the subsidiary to a certain degree. You can set it up with objects, but then it's its own entity and it makes its own decisions. And so even if the college created that subsidiary, I think your scenario that you've described could happen. Again, I'm not putting a probability to it.
Okay, thank you.
Thank you. Nizar?
Thank you, Mr. Chair. Dan, it was an excellent presentation. I want to commend the task force as well. The executive summary was really well laid out. My understanding of the PLP is that it's one of the lowest cost programs in the country for dentists in terms of malpractice insurance. And if that understanding is correct, a concern I have is that should we explore the divestment model, that it could result in higher premiums to be paid by dentists, and then the impact to the public is a higher fee schedule in order to make their practices more viable. So my question is, has that actually been borne true, that hypothesis, in any other jurisdictions that you've seen where it's publicly funded through private insurance companies, and we're seeing knock-on impacts to the cost that public are having to pay?
So I don't have enough depth to be able to answer that about any kind of payment scheme. What I would say, though, to your question is that to me, it's a narrative that we're the lowest cost. We have not been funding as a college this program to the level that it needs to be funded. And with the various pressures that I mentioned, we are inevitably increasing the cost of the program, even if we stay status quo. Those costs are going up. And so I'm really trying to shy away from the narrative of we're the lowest cost provider, because I don't know if we will be as we deal with all these different pressures. And I don't think this is answering directly your question about, will this translate into more fee, higher premium for dentists, greater fees in the fee schedule. But we have 7 of the 10 provinces and the 3 territories that use different providers. They don't operate it directly. And those premiums are what they are, and they're higher than ours right now. And I don't know if that translates directly into fee schedule changes, but they are what they are, and they're there already.
Okay, so I think that's very helpful. Thank you.
Thank you. And last speaker on my list is Anthony.
Thank you very much. I'm going to keep my comments brief, because I think I'll probably want to speak to it after the break and after the next presentation. But I just wanted to commend Dan on the presentation. I read through the whole material, and I kept going through it and through it and through it, and it was very repetitive, and that was good. But I think you really have brought it home and have brought clarity to what you've done. I'll just say one thing, and then I'm going to stop there, because I do have some other comments later on. I think we, as a regulator, and our to protect the public should be primary. And I respect the other two gentlemen that have voiced some concerns, but that is number one. And unfortunately, in today's environment, we cannot wear two hats and expect to be fair to both. We either do one very, very well, or we helter-skelter. And I think, Dan, you've done great job of bringing those points to this. And again, I'll get into it a little bit further with examples of what I hear out there from colleagues, what their comments are, but I'll stop there. So thank you.
Thank you, Anthony. So council, right now it is 10:42. What I'm going to propose is a 10-minute break. When we come back, we are going to have the opportunity, or you are going to have the opportunity, to respond to a straw poll. And that the first thing that will do is indicate if there's any consensus that appears to be building up. We will still then take time for discussion. So again, this was an opportunity to ask questions for clarification. When we come back following the results of the straw poll, you will have an opportunity for further discussion. We're going to also turn to Mark, who is going to be speaking to us as well. So this is sort of the pause in this part, but we haven't finished with it. We're going to take a break until 10:53, and I would ask that before you step away from your computer that you simply turn off your video, please. And we will come back at 10:53. If I could ask everyone to take their seats, please. So originally, according to schedule, we were going to be doing the straw poll now. Upon reflection, you've had the opportunity to hear from the registrar. We think it may be more beneficial to give Mark Eckler the floor in a moment to do his presentation, and then following his presentation, you will have had information from the registrar, you will have had information from Mark Eckler and the committees he's representing. That may be in a more appropriate time then to do the straw poll and get an idea of whether or not consensus is starting to form. And so before I turn it over to you, Mark, I'm just going to ask, I think, Angelo in the background, if you could just get the straw poll ready so that once Mark has completed his presentation, we can then do the straw poll, see where we are in terms of any kind of consensus, then go into discussion mode before we entertain any motions. So at this point in time, I would like to turn it over to Mark Eckler, Chair of the Finance, Audit, and Risk Committee, for your presentation, Mark.
Hanno, thank you. I'm flattered that you think it'd be more beneficial. I'll try to live up to it. I want to start out by thanking the task force for spending the time to give us much information that we needed for the discussion today. Dan, an excellent, thorough, yet concise presentation. To the entire RCDSO staff, especially to Jeff, Kelly, and Sharon, who supported the FAR committee yesterday, today, and tomorrow. Thank you all. At our FAR committee in August, our committee heard the same presentation you did today. We reviewed the report, its analysis, and its options presented. We then had a detailed discussion about the options. Like today, we all had questions. I don't want to preempt any of your questions or comments, but I do want to assure you that we had extensive debate on the options that are before us. There was first actually unanimous agreement that the status quo of PLP at the college needs to change. While the cooperation of PLP has been successful to date, the regulatory, financial, and reputational risks are high to continue with our current model. We had a lively discussion about the reputational and regulatory risks and how, as a college, we understand those risks and also how we should measure them. Our focus was what puts the college in the best position 5 years down the road and further. At what risk do we want to accept for the program that is not part of our mandate? What will we be prepared to stand and defend should any of these risks materialize? It is safe to say that the committee completely understood the financial risks. We are also aware that there are different ways to mitigate these risks. Creation of a subsidiary corporation may be one option. The costs have been estimated for you. There will be an impact to mitigation for both the staff, the college costs, and subsequent fees that we may have to charge our profession annually. It was by a majority vote that the FAR committee is recommending that the council approve that the college begin the process of examining options with the view of divestment from PLP. It was the majority vote after concluding that it was the best path forward for the college to divest, to cease operations of the malpractice program at some point to be determined, because this would remove in its entirety the regulatory, financial, and reputational risks, while continuing to ensure patients have recourse. We would have to mandate there would be minimal liability protection for all dentists consistent with other Ontario health colleges. This would remove regulatory, financial, and reputational risks while continuing to assure that the patients have recourse. There's a lot more to consider as just how this would transpire. There's many ways to divest should the council decide to go down this road. It is positive to see that a partner, which Dan alluded to, a partner may be able to take on PLP as possibly one divestment option, as this has not, yet it was not fully explored at the FAR committee. The implementation to divestment would need to consider the costs to the college, pay optimal attention to the human resources, a reasonable timeline, and maintain as many benefits for patients as possible. And the college would need to manage the continued risks until the plan is complete. This is an extremely important strategic topic for the college. I look forward to hearing everybody's thoughts, and hopefully we can have a lively discussion as we did in August. Hanno, thank you.
Thank you, Mark. So what I would like to ask now is for council to take the time to view the straw poll, which is going to be placed on your screen. The poll is being shared with you now. You can take out your phones and scan the QR code, or you can go to slido.com and enter the poll number on the screen to participate. And that poll number is 1410209. We'll give everyone a few seconds to get set up. We ask that only council members participate in this poll. Pardon me?
Yeah, that's the one I'm getting as well. Okay. So when we, I'm not on it, so I don't see it. So you can see it. So we'll see what's happening.
So Daniel's seeing April, you're seeing April. Okay.
Is anyone having difficulty accessing the, can somebody help Amelia and Deborah?
So what you're being asked, the questions that you are being asked to consider are on the screen now. And they're allowed to choose one, right?
Just one.
And you're being asked to choose one reflecting of where you are right now. And if you are still having problems, please put your hand up and I will send Aldwin.
Mm-hmm.
Oh,
And you can see the number.
thank you, Hatzel.
60-40.
Anthony, do you have a question? Anthony, I think you may be muted still.
I've succeeded. I found my solution. Thank you. But just
Okay.
give me a minute so that I can vote, okay?
Okay, we will for sure.
Thank you.
What's the total head count? I think 23 or how many voting, man?
There are, I think, 22 people here today.
We're at 18.
Are we? Okay.
There's 4 people not logged in. 19.
Oh, 20.
22 is the total.
We're at 22?
We're
No,
at
22 is the total council members.
Okay.
We're at 20.
Okay, I think there are only 20 people at this meeting, right?
22.
Oh, are there?
David, Brian, and Anthony Mayer are missing. The others came in. So
What about Noah?
she's here too. She's on screen.
Okay, okay.
Yeah.
The straw poll's already a majority. If you add 35 and 10, it's 45 to 50.
Okay, I think we're still waiting for one more person because I believe there are 22 people who should be voting.
There, it's 22.
Very good.
Okay, thank you. So what we have is, in terms of explore the option of completely divesting from direct ownership and operation of the PLP is 59%. Those who are not sure yet, 32%. Explore the option of a subsidiary corporation for the operation of the PLP is 9%. and continue to directly operate the PLP as currently structured is 0%.
Yeah,
So, seeing that, and before we enter into discussion, it is clear from that that continuing on with the status quo is not an option that is on the table. So I would ask if we could have the motion brought up that given regulatory, reputational, and financial risk, college staff, council direct staff, I misspoke, that council does not support the college continuing to directly operate the professional liability program as it is currently structured. So if we could have that motion on the screen, and we will vote on that, and then if that passes, that eliminates that option, and then we can go back to our discussion. So I would be looking for a mover, Deborah, seconded by Amelia. And again, I would ask you to use your virtual or Zoom hands to indicate your agreement to that motion. Okay. Okay, and so we have
Just simple majority.
21. That's unanimously carried. Thank you for that. So that motion has been unanimously carried. You have seen the results of the straw poll. I would ask you to lower your hand, and now we will have the opportunity to enter into a discussion. So we've had the opportunity for clarification. And what I would ask you to do is if you have something that you would like to say, you have an opinion, or you have options that you want to discuss, when you do so, I would ask that you be aware of the fact that what we're looking at this through is the lens of serving and protecting the public interest. So that needs to be at the forefront of comments that you're making or suggestions that you're making. And at this point in time, I will start with a speaker's list. Nalan, I'm going to go to you first, please.
Yep. Thank you, Hanno. First of all, I'd like to commend the task force for that very exhaustive report. I think it was really well done. And it's not hard to walk away from that and realize that there has to be a change, that like the current path is not sustainable, as can be seen by the vote that we just had. And so when you have a change, there has to be a clearly defined starting point and then an ending point. Who knows where the ending point will be, but the clearly defined starting point, I think, is important. And I don't believe we have that. And there's a risk by not having that. So just some numbers. I know this from before we had our fee increase. Our PLP component of the registration fee that the dentist pays was about $680. And comparatively in Quebec, I think it was $1,375. And if we were to go to a private source, it was $2,100. So those were the numbers before we had the fee increase that was instituted a year ago. So that's a clearly defined starting point, $680. However, that's false because, as we've seen, it's artificially low because the reserve fund is not being funded properly, and for other reasons too. So if we were to make this change, this could be a problem if suddenly members are used to paying $680, and then if it ended up in some private group to issue the insurance, it went to $2,100. This is a problem for communicating. This is a problem for our members. So I think if we move in this direction, should be some consideration to a clearly defined starting point. What exactly does the PLP insurance cost? Thank you.
Thank you, Nalan. Next on my list, Aaron.
Thank you, Mark. Thank you, Mr. Speaker.
Microphone, please. Thank you.
Thank you. Thank you, everybody, for the excellent presentations and the very informative options that have been laid out.
Now, one thing that I noticed was the number one recommendation. The task force highlighted that the program is effective and efficient. So one thing that I think we're all in agreement with is this is a program that has huge benefit to various stakeholders, and that's not something that's up for question. I would like to see some more exploration done on the opportunity to transfer this program somewhere where this value could be maintained. So to some organization that has some interest in oral health and the interest of our patients. And I think there's tremendous opportunity for this. If the program was housed elsewhere, I think there would be opportunities for the program to grow and also expand into areas that would be of even bigger benefit to the stakeholders that aren't constrained by the RCDSO's mandate. So for a couple examples I can think about, they would be a little bit more free to use the data if they're not under this restriction of the conflict that we have. They could use it for various things, for CE courses that another organization could develop. Maybe even a mediation program could be reinstated that might help to divert low-risk cases away from the college if it could be worked out through separate infrastructure. A lot of these things can't really be done within the RCDSO's mandate because of the conflict. So I think that transferring ownership of the program outside would deal with a lot of the risks that we've presented. And also I think it would provide a lot of new opportunities. So I'm hopeful that we could see some more exploration into this realm to see what could be possible. Thank you.
Thank you, Erin. And Anthony?
Thank you very much, Hanno. I would like to just lower my hand there. I would just like to point out that speaking to dentists at functions at the dental society level is that I often heard and hear, what the heck does the RCDS do for me? Like, I mean, I pay my fees, they represent me. What am I getting out of it? They just don't understand. So I think we can focus on what we will be able to do for them, and that's obviously to fulfill our mandate on a provincial type basis, and that is to protect the public. And we can do that by offering them the remediation aspect we do if something ever comes in terms of a complaint or anything else. Being a member of the ICRC, our aim is always to remediate. What can we do to make this individual a better dentist? And I think if we take that and focus in on that, that's how we can be a benefit to the entire profession, make their life easier so that they have an easy flow through their professional years. With regard to I already voiced my opinion before, we can make sure, we can mitigate that they have coverage. We can from the examples of other organizations that have done that, and we shouldn't be concerned about the investment income that we lose from having this $25 or so million sitting there and gaining some income from that. We can concentrate on our own funds and our own fees, and to have a buffer there and be a regulator as the best regulator that we can. Again, we can't have two hats. It's going to be difficult the longer the period goes on for regulators. And so let's be the best regulator as we go forward. Thank you.
Okay, Anthony, you were breaking up periodically there, so I just want to give you the opportunity to clarify. So are you then speaking more in favor of creating a subsidiary or in terms of divesting, or what is it that you were speaking in favor of specifically?
Sorry to hear that I was breaking up, but definitely in terms of divesting completely.
Okay, in terms of divesting completely. Okay, thank you. Next on my list is Vivian.
Thank you, Hanno, and thank you for the task force, Mark. And I think this is very, I was really debating last night because I hear a lot of conflicting information. And today, I think because our role here is to protect the public, and I think, of course, is important for the dentists who have the coverage for liability. I'm thinking that if we diverse the program from the college, I think the mechanism should be there to make sure all the dentists have the proper coverage. And I believe when I was chatting a little bit with Sarah that for all three options, there will be, the college will be there to ensure that all the dentists are properly covered. So that's my opinion. Thank you.
Thank you. Next on my list is Peter.
Thank you, Hanno. I think, we can talk about the financial concerns. We can talk about the reserve shortfalls. I think ultimately, what's going to decide this whole issue is going to be the ethical and moral dilemma that we all face as a regulator who sort of plays both hands in a situation through PLP. We're trying to please the patient, we're trying to please the profession, we're trying to protect the patient, but at the same time we're trying to protect the dentist as well. The other point I would make is that I think it's probably, after this meeting, would probably be a good time to see if we can get some comments from public and also from the profession as well, just to see what they think of this. I think it's a huge issue, and I think if it's just 20 people sitting around a table making that decision without input from either the public or the profession, I think that would be a mistake. Thanks.
Thank you. Jamie?
Thank you, Mr. Chair. And let me also thank the task force and all your numerous presentations, Dan, and Mark, for your synopsis of finances. A couple of points here. One, it was a unanimous decision that we look at divestiture, and I voted in favor of that based on financial risks, quite frankly. I know there's reputational risk, but I do believe it's not appropriately run from a financial perspective. So thanks, Mark, for pointing out everything that you did in your meeting, your last meeting. We need to communicate very well to the dentists going forward. We have to communicate to them on the basis, all right, the council voted status quo is not doable. I think there's going to be a number of questions from the profession as to what really is the outcome of a decision that we've made today. So, whatever that communication strategy is, I think we need to have it very clear. And when we were doing the straw poll, there was a fair component of that poll who really didn't have an opinion or didn't have enough information. And so when we go down the divestiture route, we need to know much, much more. I frankly, the costs associated that I saw with both divestiture options seemed very high to me. And so in the process of looking at divestiture, we need to see proposals. We need to understand who the potential partners are in order to make a final decision on which way we go, whether it's a partnership with someone that's like-minded or perhaps providing the same benefits to the public and to the profession. So I strongly urge us as council to ask those questions and demand more information, more in-depth information on possible solutions, and communicate that journey with both the public and the profession. So thank you.
Thank you. Judith?
Yes, thank you. I have to say, my voice carries anyway. I have to say that I probably agree with most of the things people have said, but I just wanted to add that, we talk about financial risk in some ways as not being as though it should not be the foremost consideration, and that's true. But I think that once you are into the area of financial risk and experiencing financial risk, that leads to reputational risk and other risks coming to fruition. So I don't think we can ever really not look at the finances. I'm glad to see that status quo is off the table. A lot of assumptions, I think, were built into this analysis in this report. But one of the things that we're not talking about yet is the fact that the issue of the underfunding of operating reserves is what I would call a clear and present danger for this college. And it's becoming clearer to me that we really don't have the capacity to both fund operating reserves and to fund the sort of the gap, even up to 29 million, with respect to the PLP reserves. And so that leaves us with having setting up a subsidiary or divesting. To me, a subsidiary is a non-solution. I think it's an option that provides some people with an element of almost psychological comfort. But the possibility of real financial protections for the college and therefore for the public are really absent in that model, I think. I think that it's, as I said, I think it's a non-solution. It's just, in theory, separating it out so it doesn't appear maybe with our financial statements or whatever. I don't know if they do, but the point is that it's not going to have the kind of impact that we need it to have. And so that, for me, leaves us with divestment. So I'm totally in favor of divestment. I also need more information about what I would hope that would look like. I mean, as you know, I've said before, I'm a lawyer, and so I pay Law Pro. I also know that as lawyers, the combination of our membership fees and Law Pro is probably double, if not a little more, than what dentists are paying. And that's neither here nor there. It's just that, and you're right, a number of years ago, when the Law Society found that it had mismanaged the books, for a period of several years, we were paying $10,000 a year so that they could recoup the shortfall. And so it is done. I'm not recommending it. I'm not saying, I think that we need to keep in mind that the dentists have to be able to practice with a level of insurance that secures the public interest and their own, and that is not sort of like massively unaffordable. But I do think that the way to go on this is divestment over, a defined period of time with a probably, again, we'd need more information, but probably with a model whereby you had negotiated a deal with another company, like Law Pro or whatever, to take on dentists, and that insurance with whatever that entity is mandatory. And in that way, the public is protected, because dentists still have mandatory insurance You know, it might not function in the more sort of holistic, humanistic way that apparently PLP is operating, and I really admire that approach. But we'd have to see. I mean, you can build all kinds of things in when you're setting these things up from scratch. So I'm wholly on the side of divestment. And I just wanted to say that I really wished that there was no I don't know yet option, because on that poll, because I think that I'd like people to take a position on council. I'd like to know what that position is, and you can always say, I need more information, I don't know yet. So that's always the case. I need more information, I don't know yet, but I know enough to know what my position is going to be so far.
Thank you. Osama.
A great presentation, Dan. And it's a good report. So I have 3 comments, and one of them is actually a question. The first one is, what percentage of dentists already obtain additional coverage? And that may play into all this, and it may have a role in terms of the data that's necessary here, if dentists are already obtaining additional insurance. The second is, you know, there's the report, but then there's, as Peter mentioned, you know, obtaining more information from or surveying stakeholders. That would be valuable as well, in addition, in going forward. One of the things in the report that I'd like to comment on is the value of the risk assessment. You know, maybe I disagree with some of the comments already made, but the value of the risk assessment in the charts that were made were not very valuable to me. I've never seen, you know, usually when you have a risk assessment, it's compared to something. So this needs to be a comparative risk assessment. So you need to compare the different routes or the different options to one another based off of the risks. They're not, in essence, separate, because they're being compared to one another. And so modeling would be very important in this situation. So in essence, you'd have to gather some more information and do some modeling for all the different options, including what Daniel had mentioned is a big red flag, obviously, for, you know, that may have reputational implications as well. So I think this is a great start, and we have arrived at you know, some progress, right? We haven't come up with a full solution yet, but we've definitely some progress. But I also think that in order to really come to a good solution, there needs to be comparative risks. The comparing, it's called a comparative risk assessment, and modeling of the different options.
Thank you. Mark
Sorry,
Eckler.
could I just ask, you know, when you say different options, you're meaning options within divestment or options
I would say
between the different
between them. Yeah, between them.
Thank you. Mark Eckler.
Thank you, Hanno. So I have 2 comments. The first comment is speaking as chair of the FAR committee. My second comment will be speaking as Mark Eckler, councillor. Minor clarification to Jamie's comment. The FAR committee did have a consensus that it was unanimous that the status quo should not remain as is. It was not unanimous that we voted in favor of strictly divestment. It was by majority vote. That's the first comment. Now, speaking as a councillor, not as chair, the question I have, in following up on what came to mind after Daniel's comment, is should divestment be the only option explored? And without guidance not to wind up PLP, and after learning information last night about claims made and that, what we can mandate practicing dentists get insurance, which is a must to protect the public. What do we do with the retired dentist who is not going to take out insurance, yet can have a claim made against them? And if PLP doesn't exist, how is the public protected, as I'm closer to my retirement age than at the beginning of my career, if you didn't tell by my bald gray hair? So that is a question I don't know the answer to. I have an 80-year-old father who practiced 49 years, never knew the college for good reason, was in good standing. Who protects him? Who protects the patients, the 35,000 patients that he treated? Because to my knowledge, and unfortunately from my experience, there doesn't seem to be a statute of limitations on complaints or inquiries that can be made.
Thank you. Nizar?
Thank you, Mr. Chair. With the fear of being redundant, I want to echo my congratulations to the committee and others. My decision at this point is to support full divestment. The decision was arrived at by three influencing factors, which I share with my colleagues. My review of the entire task force report, the majority, thank you, Mark, for the clarification, the majority recommendation of our FAR committee, and my own professional history with this kind of an issue. I want to lend support to my council colleague Judith, whose observation about the subsidiary option, for me, forgive the candor, but for me, a subsidiary option is kind of like suggesting we're half pregnant. We either are or we're not. And so I think we need to come down on a firm direction, given the influence of some of these things that we've read in the report and we've heard from our colleagues. What I would suggest is, depending on which option we land on to support the staff and the FAR committee's additional investigation, we as a council help create some form of a framework, a decision-making framework that allows the investigators to come back to us eventually with a series of options within a single option, like either divestment or subsidiary. And I think we actually have that in our strategic slide, the one that accompanies every single meeting that is in our package today. And so for those who may be following online, there are plenty of principles, a principles-based framework that we can use as a council to direct others to do some additional investigation. For example, the 3 points that have always resonated for me are: we take an evidence-informed approach to decision-making, we apply a risk-based perspective in regulating the profession, and we integrate the principles of equity, diversity, and inclusion, which I think is aptly appropriate both for dentists and our responsibility to the public. And so, the last thing I would say, and then I'll give it back, Mr. Chair, is I talked at the very beginning about my professional experience with this. I've been in healthcare for 33 years, and the Ontario Hospital Association faced this similar decision in the early 1970s as well, where there was perceived, and therefore real, conflict of interest associated with their ownership of Ontario Blue Cross. They divested themselves of Ontario Blue Cross, and so I would share that example with my council colleagues, because you can look at this issue as an opportunity. The divestiture of Ontario Blue Cross in the healthcare system among hospitals and others resulted in an endowment fund that in the billions today that continues to pay decades later. And so should we decide as a council around divestiture, I think we have an asset based on our public good, our public sort of our goodwill and brand associated with the PLP, that we can actually turn a particular, let's call it a benefit that would allow the council to further fulfill its mandate and support patients going forward. So I leave that as a hypothetical possibility around divestiture. Thank you, Mr. Chair.
Thank you. I have 4 more speakers on my list, and I just wanted to let people know, I mean, we are taking notes up here in terms of comments that are being made, and my hope is that when you see the motion that comes on reflecting the comments, you will also take comfort in the fact that the language talks about asking or directing staff to explore the options. So again, nothing is carved in stone at this point in time. I think it allows for ongoing dialogue, more information, questions that still need to be answered. So again, I don't want to jump the gun, but I do want to sort of put it out there that language about exploring the options would be in a motion that you will be asked to consider very shortly. Amelia, you're next.
Thank you. That was an excellent presentation. Thank you. I agree with many of the comments that our council members have mentioned, like Jamie, Osama, Judith, Nizar, Mark. Thank you. I was actually in the don't know category of the straw poll because I don't have enough information to make a decision based on what I've read several times, and today I believe that we need more. Another comment I have is I read from the report that there's a potential shortfall of 6.7 million to 18.6 million if there were a catastrophic event. I'd like to know, what is that percentage of that happening? Do we have that information?
I would turn to Jeff to maybe respond to that.
So those were based on the recommendations from PwC, our actuary, and we can provide that we can come back and provide that information. Some of the information was based on their modeling of like a 1 in 100 year scenarios, but they did also other scenarios that were less than that. I don't have that information in the top of my head, but we can provide that information. And FAR, it was all shared with FAR as well.
Can I comment? Okay, once we get that information, what's that chance of that happening, let's say, on a yearly basis? Is it just one-time basis or ongoing basis of a catastrophic event?
Well, I think it's a one-time basis, but it could be 50 years, it could be 20 years, it could be next week, right? It's impossible to tell when an unexpected catastrophic claim will occur.
But well, my concern is, let's say there were, okay, it happened like, what, 2017, that large class action lawsuit. What's the chance of that happening like once a year? Like it happened, let's say 1 year. Is there a chance of it happening again in 2 years? Because that would be a huge shortfall.
Sorry, can you repeat your question?
Well, my concern is this. Let's say there was that catastrophic event. Let's say, obviously, there was one 2017 of multi-million-dollar lawsuit. If you had that one event, let's say next year, I'd like to know, is that chance of happening again another year? Because you never know with these class action lawsuits. I'd just like to have more information on that.
I don't think we're able to comment on that.
I was going to say the same thing, like we're trying to use a crystal ball to predict the future, which we don't know, which is why we rely heavily on actuaries to provide us what their assessment would say is the right level that we need to be at. We, council, can make a decision not to increase the reserve, but you would be doing so with risk. And I think that's kind of the point, that we have to rely on that information, and then we have to use it either as given to us or some other way that you think would best manage that risk. But nobody can predict the future in terms of, well, they talk about 1 in 100 years. Is it 100 years from now, or is it next week, as Jeff said? But to be prepared, you rely on that assessment to put the reserves up to the right level.
Okay. So I realize I'm out of sequence. I'm not asking a question, I'm offering clarity. Based on my statistics background, what a 1 in 100 year event is an actuarial estimation of the probability of catastrophic, unpredictable events occurring. The closest example we can derive from that as an actual example of a 1 in 100 year event is COVID. The previous world pandemic was the Spanish flu. So it's the unlikely, unknowing likelihood of, or probability estimated through a series of random events actually taking place. And so the PwC report specifically says, in the event of another COVID, this would be the impact to PLP. So it's a highly unpredictable, unknowing, and that's why Dan and our CFO are not giving us a confirmed answer, because they literally would need to have a crystal ball to say, what is the likelihood of a 1 in 100 year event circumstance?
Thank you for that. Next on my list is Deborah.
Thank you, Hannah. Again, excellent report and highlighting some important information for the RCDS going forward. From what I'm hearing, is there's just a lot of information that we need to know with this next step going forward. It's like planning a trip. You want to know the details along the way. You have the end goal, you have the beginning, but you need to know all the factors in between. So I'm suggesting we ask the task force to provide details on the models with the risks and the benefits of the different options so that we can make better information. We could also ask the task force to look at the Blue Cross model, successful Blue Cross model going forward, to learn from their journey, going from basically an independent insurance taking over the medical liability associated with the medical profession, because we're following in that pathway. So we can learn from their experience, so we can consult with them. Another also possibility dealing with the retired dentist model and looking at that is maybe possibly looking at a hybrid model. So as of a certain date, we look at these dentists that are part of the RCDSO have private insurance, but the ones that are retired still have a PLP option that's phased out over a period of time, so there's just not a hard deadline, so that we could accommodate different options. That's another thing I would ask the task force to look into. Thank you.
Thank you. Last on my list is Jamie.
Thank you, Mr. Chair. What I'm hearing from some of the professionals, and in particular your comments, Daniel, on what dentists are going to do going forward, understanding there will be a new model at some point in time. Can we ask those investigators to look at, and maybe this is part of what Peter was asking in terms of surveying the professionals, what are the best parts of the PLP, I should say, and try and encompass those into a model going forward. And again, ask partners who are involved in that decision potentially to ensure that the best parts of the PLP are enshrined in something new. Mark, for you, estates of dentists, by the way, are covered under PLP. There are claims made via estates. So it goes beyond just the retired people. Final question is for you, Dan, and that is, would a separate entity be legislated in some form? And with the CMPA and the CPSO, is that legislated? I understand that the government somewhat funds or backs up the CMPA, and would we expect the Ontario government potentially to backstop a new structure?
So I can't certainly speak for the intricacies of those details, but I can say that the CMPA, the Canadian Medical Protective Association, is a completely separate federal entity. It has no ties whatsoever to regulators. it has, through years of negotiations, had funding that comes through the federal government. And that is to support premium payments. It depends on specialties as well, because some specialties of medicine are higher risk. But none of what we're talking about is looking at a GR strategy at this point to look at legislation or to have any independent separate entity funded. That's not within our purview. If this council is looking to explore what are the options, what could divestment look like, what could as you said, what are the best things about what we do currently that we would like to see preserved, we would have those discussions with potential partners or organizations, and then they would have to develop that and figure out what that needs to look like for their organization. So I think what I'm hearing, and I'll turn it to Hanno, is this sense that we want to preserve some things from this program, but we don't necessarily want to directly operate it. And so can we live in both worlds? And so I think that's a reasonable expectation to start to look at that and try to figure out if that's possible.
Thank you. And Nizar, your hand is up, but I didn't know if you was, okay.
And I appreciate, Mr. Chair, I'm sort of dominating the conversation. It's absolutely fascinating to me. I wanted to assure the very legitimate question that my colleague Mark asked earlier about what happens to those dentists who have stopped practicing and have, or more importantly, what happens to the patients who are affected by dentists who have stopped practicing. It is very common, I would not take this comment as gospel, but it is very common for another absorbing organization to be responsible for prior conditions. And so as an example, as a board member, I have officers and liability insurance. When I stop being a board member, I am still protected under officers and liability insurance for any claims against the board's actions that may have taken place during my term. This is very common. It's quite acceptable. If Sun Life had provided us with that insurance and then subsequently Sun Life went out of business and Great West Life took on that responsibility, they would have to, under legislation of that approved merger under the Canadian Corporations Act or the Ontario Business Corporations Act, assume that responsibility such that patients can't be lost and say, because of that merger, I've now lost my ability to be appropriately compensated. So I would say, please don't take that as gospel, but it is informed based on just a number of other experiences I've had.
Thank you very much. And last speaker on this topic is Rod.
Thanks, Hanno. I've listened to everybody around the table. By the way, some excellent discussion. I think I resonate highly with what Aaron raised and has been repeated, that we need to find a path forward of maximizing, optimizing, or maintaining the benefits of the current system while minimizing the reputational, regulatory, and financial risk. That's the nut of it. And and also we need much more information. I as we go forward, I speak as a FAR member and one of the, I guess, dissenting opinions going forward, but primarily my dissent was the need for more information. And that I think has been echoed highly today. Looking at the lay, and we need to look at the lay of the land out there a little more deeply. I think we need to understand further what Alberta and Quebec, how they fend off reputational, regulatory, and financial risk when in fact they are maintaining in-house systems. We need to, there's 10, 11,000 dentists in our organization. There's 31, about triple of that are doctors in the province. And Dan mentioned, per Jamie's comment, that the CMPA program is a federally funded program, but I believe, I'm not for sure of this, that it is paid by the Ministry of Ontario of Health. And hence, there's a natural conflict of interest in the government representing and paying out that money to doctors. And it is an interesting fact that it's been in place for 50 years. But my concern that I raised with the group was the equity of doing that, given what we've been asked to do from a reputational standpoint. And I think we need to be heads up going head forward on that, on what we do. So it's, am I in favor of divestiture? Not necessarily, but I am in favor of change. And I really think we need to take a wide view on the landscape as we go forward and make sure we have, a comfortable, because divestiture on itself is not, can be a tough end. There's arguments to the effect that the CPSO's program, they are fully divested, is more of a doctor's defense fund rather than a public interest fund in the public interest. And I think everybody's had that aware in discussions in the past. So I'm in favor of much more debate in terms of before we make a decision.
Okay, thank you. And last speaker is going to be Mark Eckler.
Thank you. Sorry, Mark Trudell? Mark and Mark.
Mark and Mark.
We'll bookend it. Speaking as chair of the fire committee, following up on Rod's comment, just to once again clarification, the dissenting opinions on the fire committee were not against divestment. It was strictly to gather more information. So there was no opposition to exploration and getting information. Thank you.
Thank you. Mark Trudell.
Thanks, Mano. My comment, and my only comment, I speak from a position of as a public member and a member of council. I'm quite concerned about the financial shortfall of the reserve presently. I believe we all individually and collectively have a fiduciary duty to put that high on our radar. It's been brought to our attention by independent third-party financial advisors. I would encourage council that any motion going forward, now that we've gone around the table a few times, that a timeline be attached to that motion. And in particular, I'm concerned that we will make a decision to come back with more information, but I don't want that to correspond to punting the ball down the road again and again and again. I would like the motion to have a timeline so that this council, when it next addresses this matter, is empowered with not only additional information, but is also aware that time is of the essence to make an informed, thoughtful decision, but time is of the essence in light of the fiduciary duty we have in respect of from a risk management point of view. Thank you.
Thank you, Mark. So what I have heard more often in taking the notes that I've been taking is voices in favor of divestment. We've heard lots of comments around more feedback, looking at a variety of proposals, seeing some of those before definitive decisions can be made. Mark Trudell just said he would like a timeline. Other people have said, we are going to take the time that it needs. So I think those are all comments that we've heard. So I would like at this point in time to have the motion put on the screen that deals with divestment. And I would like, when we see it, to draw your attention to the wording. And the wording is that council directs staff to explore the option of completely divesting from ownership and operation of the professional liability program. So I think that's more reflective of the kinds of comments that we've heard today. And hopefully that language of exploring the option addresses some of the comments that we did here. So, Deborah, are you making a motion? You moving to that effect? Nazir, you're seconding it. So again, I'm going to ask you to raise your virtual hands. All those in favor of that motion, please indicate so now. Okay, thank you. So that has been unanimously carried. Thank you all for your thoughtful I'm going to turn it over to you, don't worry. Thank you all for your thoughtful consideration, for your questions, for your comments. I think that was really important. Hopefully, you've also felt that taking this time and giving you the time to ask these questions and the time that it took in terms of listening to the presentation has helped you to make a more informed decision. So I'm going to stop speaking now, and I'm going to turn it over to Dan or Harinder for closing comments.
Well, Harinder can close, but I just wanted to address. Oh, there's some, I will step back.
So
Could I say a couple of remarks just because they may address possibly what some of you might want to say? Because I wanted to go back to Mark Trudell's comment. And what I would suggest, I know it's not in the motion, but we will bring you a progress report in December. We're in uncharted territory in terms of what we need to do to pull this together, but I've heard your direction in terms of exploring it, figuring out what is it that we value from this program, exploring what possible partners there might be or organizations. I can't commit to you to have that whole plan by December, but I can commit to bringing back a progress report in December if you're comfortable with that. Go through your list, Hannah.
yes, so thank you, Judith. I've got a list now, so I will go back to that. So Rod, you're next on my list. Or first on my list.
Sorry, I forgot to lower my hand. Do it soon.
Oh, okay, thank you. So then I've got Judith, who'd like to make a comment, and Jamie. So Judith, I'm going to you next.
Could we not have a subsidiary amendment of, to also direct that staff provide council with not just different options, but different models of divestment with a comparative sort of SWOT analysis, such as Osama was referring to, and that all of this be done for the December meeting, so that we have the time frame and we have more specificity in terms of what we're actually looking for.
So I'm not entirely clear, and I don't want to take up council's time, but I'm happy to talk to Osama, who raised this, and others, because I'm not entirely clear what you mean, because now you're talking about a subsidiary.
No, did I say, did I say that?
Subsidiary
No,
at
I
the
meant
beginning.
divestment models.
Okay.
Sorry, I misspoke.
Yeah, and I think that would be part of the exploration. And so that may be, and I'm not sure how far we'll get, but that will be part of what we're looking at in terms of, what are the different models and what does it do for us? Like, there may be, it's a trade-off, right? In terms of we can get this, but not this. And that's part of the analysis.
Yeah, it's just that I thought the motion was a little bit vague and didn't really have the timelines in it and didn't really have the sort of the comparative analysis as an ask in it. So maybe I could just go on record as putting those asks in along with others.
Thank you. Jamie?
Yeah, my final comment, I promise. You put in every one of your scenarios, Dan, of the options, staff as being a priority. I'd like to ensure that when we do the investigation, and I'm speaking now on behalf of the chair of the PLP committee, it's a fabulous staff, lots of experience. Anybody who would want to partner with the RCDSO offering an insurance option would want those employees without question. So I'm asking council to ensure that our staff is still at the top of the list when it comes to looking at solutions. That's one point. Mark Trudell, you wanted to expedite the decision on how to balance the operating reserve. Was that your question?
The impetus for timing
yes.
is the operating reserve deficit.
Okay.
I do not want to expedite that. What I want to do is I'm encouraging council to encourage the leadership team to put forth additional information in an expedient manner so that we are in a position empowered with additional information to make informed decisions at the earliest possible time. Distinct from continuously studying this matter into the next council and the next council and the next council, while all the while we are operating under the veil from a risk management with a substantial reserve deficit. And from my assessment, we're in a very dangerous zone in terms of our fiduciary duty to not take our eye off that. Does that make it clear?
Much clearer. And I think what the profession will see out there is, the PLP no longer is status quo. And at the same time, to be able to balance the operating reserve and the deficit, they're going to have to pay up. And I encourage the communication to the profession to be wary of that going forward. Thank you.
Thank you. Anthony?
I have one final comment. I look forward to the update in December at our next meeting, but I want to leave with a positive aspect. PLP has been a great and continues to be a great program, and time has certainly it's on its side. We have a great value there, and it's a great value in terms of the book value. People will be very, very interested in taking that over in whatever form that will be, and obviously we'll be part of that decision making. But let's not forget that we have value there, regardless of deficits and all these other negative aspects that we know are there. And so I look forward to the fact that I don't think there will be huge difficulties about finding entities to take that over for us. Thank you.
Thank you, Anthony. And I'm going to turn it over now to Harinder for closing comments, please.
Thank you, Hanno. And I want to thank all the council members for their wisdom, their comments, and the task force which produced the results, and Dan for presenting in a very clear way what you did today. I want to re-emphasize what Jamie asked and Mark Trudell has addressed. In view of this report and our deficit and all the information is in front of us, and a fiduciary duty this board has, I am again re-emphasizing what Mark Trudell said. We cannot punt it down beyond December. So there will be more information. We have been talking at executive and between Dan and I, there's going to be huge communication emphasis, and staff is getting ready for it. I think we need to communicate it very clearly to staff, to the membership, maybe the public need to know as well. And I think our communication staff is ready. So thank you very much to all, and I'm very happy the way things have gone. And I hope that everybody feels that they have been heard. And this will be the way we will be conducting our council meetings from here on. Thank you.
And thank you, Harinder. And taking a lay of the land, I think this has been a wonderful opportunity to share tons of information and questions and concerns. It has been a more lengthy process than we've been used to in the past. I think it's probably important, Andrea, that we're going to sort of take the next item on the agenda and postpone it after lunch. I think what we all need now is we need a lunch break. So I thank you again for all that you've done this morning. It is now 12:10. I'm going to ask us to reconvene here at 1:10. And a reminder that when you leave your computer, you just turn your video off. And for those listening on the public, the YouTube will stop now, but will start up again at 1:10. So thank you all, and have a good lunch.
position. And over past the midway point, what I might do, what I might suggest is just close the laptop, just in the odd chance.
That's right. That's right. I think he's not always great at being accessible. Like yeah. I don't know actually if we have an emergency contact. It would be not a bad idea to ask about that. Angie would know if we do. I don't know who's in his life. I don't know much about him personally, so I'm not sure. But yeah, I agree. I think it's a worry. He's quite frail. When I saw him in the summer, I saw him last July. Yeah. I know. And I don't know, like, I don't know much about him on a personal level. Like, he's nice to talk to and stuff, but I've not gotten to know him, so I don't know for sure. Angie might. Yeah, I know he's not really responding to messages and invitations, so like similar in August, like or July rather, we didn't know he was coming in the house and he showed up like after the meetings. It's a real worry. Yeah, I hear that.
Aldwin, may I ask you to begin this discussion, please?
Sure. Thank you, Hannah. This afternoon, we have a guest speaker who is going to provide information about cybersecurity, including Council's oversight role for cyber. As an important business risk, this is in line with the enterprise risk management program we're currently developing. So enterprise risk management, as many people will know, is the process where we will identify and address key risks to corporate strategies and objectives. Reporting the status of significant risks is an important governance activity for Council, and we have started that framework. We brought it to FAR and senior staff, and intend to bring something to Council in December. Now, we don't expect Council members to be experts in either cyber or risk management, but you should definitely feel comfortable to ask questions to ensure you have confidence that risks, including cyber, are being managed effectively. So I'm going to hand it over to Aldwin Armstrong, our Director of IT, to talk about some of the recent security improvements to our environment and to introduce our speaker today. Aldwin, over to you.
Thanks, Jeff. In our ongoing effort to ensure council, panel, and committee members are protected in the work that they do, we've made several changes over the past 6 months. Some of these examples include the rollout of a new cybersecurity awareness training to council, panel, and committee members. So this is an expansion of the existing staff program, which is intended to help individuals understand the importance of cybersecurity and to teach them how to identify potential threats and to respond appropriately. Additionally, working with our partners, we continue to update and modernize our security solution. This includes implementing a new external vulnerability scanning solution, updating our secure files, secure mail, and Citrix platforms, as well as implementing an additional identity monitoring solution that helps us to identify potentially risky sign-in activities. Beyond the technical work, however, our privacy team has also implemented a new policy regarding secure communication of confidential information that gives direction on how to safely communicate electronic and hard copy confidential information outside of the college. As our security controls continue to mature, we've begun to work to align our security register with the overall enterprise risk register. As cyber continues to be a leading business risk, not just at the college, but for all industries, we will be working to increase Council's understanding of your role in our cyber risk management approach. And so, I would now like to introduce you to our esteemed guests. I'm very pleased to introduce Imran Bashir. Imran is a partner and national public sector cyber leader with KPMG. He brings over 20 years of experience advising on cybersecurity to both the public and private sectors. Imran is focused on helping organizations adapt to the cyber threat landscape. He's developed expertise in cyber governance, which will be of keen interest to Council today, as well as strategy, incident management, and risk management. We're pleased to have you here with us today and keen to hear your current thinking. Over to you, Imran.
Great, thanks, Aldwin and Jeff and everyone for your time today. Speaking of time, I just want to make sure I know you're a bit behind schedule. How much time do you want me to talk for? Like I could talk for hours, so you may want to cut me down just to make sure. Is 20 minutes still good?
That's perfect.
Okay, I'll go with that. And if we have time, I just want to eat in the rest of your agenda. So first of all, thanks a lot for the intro. A lot of kind words there. I just like cybersecurity a lot. So that's the summary of my career. To be honest with you, I just enjoy it, find it a lot of fun. And I'll hopefully explain why. I'm going to try to share my screen here. Bear with me for a second. I think this will work. Yeah, can you just confirm you can see that okay?
Yes, we can.
Excellent. So, Jeff and Aldwin both already spoke pretty well on some of the key points I want to bring up today. But the one I always start with this one in that when I started in cybersecurity like 23 years ago, it was just for the nerds, and it was an IT job that no one cared about. It was kind of a backroom job. And that was fine then. That's why I got into it, to be totally honest with you. But over the last several years, I would say specifically in the last 5, it's become more and more a business problem, not just an IT problem for the nerds to take care of. It is now a business problem that has to be front and center for everyone, for boards as well, obviously. And as you can see from this is the most recent kind of survey done by the Alliance Risk Barometer Group. And cyber, for I think now the 3rd year in a row, is at the top. This year it was tied for first, but it's tied for first with a pretty important one as well about business interruption. But what really opened my eyes was a couple of years back when COVID hit. COVID was number 2 to cyber, which was fascinating to me because we were in the middle of a global pandemic. But the point being is that words like cyber were never mentioned at the same breath as words like energy or climate change or political uprising or whatever the case is. So it just goes to show you the global importance of cybersecurity. That is no longer something that can be kind of kept in the back rooms anymore. And I don't love this slide because I hate talking about bad news. I'm not a bad news person, but I will give you this as a context slide that the cyber attacks don't seem to stop anytime soon. And I'm not using this as a scare tactic. This is meant to be just the reality of every sector. Like, no one is immune to this. Bad guys just keep taking advantage of the vulnerable, and that's just sadly how the human race seems to work over our evolution. And it got worse during the COVID pandemic when a lot of more things went remote. A lot more things got digital, and cyber attacks went through the roof. And honestly, other than a small downtick when the Ukraine war started, and folks in Russia were preoccupied with something else, it's been nothing but a steady increase over time. So that's, again, not a scare tactic, just a reality check that every sector seems to be getting hit. You may have heard the recent news from last week of MGM, of all places, in Vegas getting hit, and they've been having a rough go lately. I'll explain how that one started in a few minutes. But the point being is that, and sometimes you're not the direct target of it. In some of these instances, you are kind of caught in the crossfire, so to speak, and that's just par for the course these days. So the other challenge around cyber is most people focus around the financial damage. A lot of organizations focus on financial, and it's going to cost more, and you're going to pay a ransom and such. And what we often forget, and me, I should give context to, I was formerly the Chief Information Security Officer of the Government of Canada here in Ottawa. And in government context, and I'm sure in your context as well, it's often more the reputational and trust damage that is more impactful than the financial. I'm not downplaying the financial by any means, but there's a reputational aspect and a trust aspect that you all stand for, and that the government, for example, stands for, and it undermines that fundamental thing. And that is a really hard thing to first quantify, and then second, regain after you lose it in the first place. So I want to make sure that's highlighted as well, that it's not just about money here. There's a bigger element at play. So who and why, and you must have heard this before, like there's a whole bunch of, different actors out there. I won't go into crazy detail on this slide. But I, it ranges from nation states. Again, in my past life in government, we were often under attack from nation states. This is a very common thing for governments, but also organized crime likes to, get at sensitive information. You got to think about what you hold that they might be after. Obviously, now I'm shifting a bit to the right of the slide. Anything private, anything about patients, anything about, dentist community, anything about any personal information of any kind. Payroll is often a common one where they can see either social security numbers or bank accounts or anything else of that like. So any kind of intellectual property that you may hold. There's also, and again, I'm going back to my government days, just random hacktivists, or for hacktivism reasons, wanting to disrupt things. And we had one, I remember, it was a Canada Day in 2016, where the government had just previously announced some sort of policy. I think it was an environmental policy of some kind that someone was upset about. And just for nuisance reasons only, they put a denial of service attack on one of the main websites and shut it down for about 2 days. And again, didn't steal any information, didn't do anything other than disrupt. But the message that it sends is A, the government was vulnerable, and B, that these hacktivists want to just send a message, and it sends a bad message to your constituents because now you have citizens that don't have as much maybe confidence in the system that is supposed to be trustworthy with their information. So that's one of the other aspects to keep in mind. And the other thing on what are they after, a lot of people focus on the confidentiality aspect of it all, going into somewhere and taking private information. They forget about, there's a triad in security, we call it, it's CIA, confidentiality, that's obviously the protection of private stuff. There's integrity, which just means changing, not necessarily stealing the data, but changing the aspects of the data financially, maybe adding a zero or subtracting a zero, but it's still the same data underneath and not being stolen. And then availability is what I just described, taking something down so it's no longer available for anyone to use. No information was stolen, but the sheer lack of availability is the impact itself. So it's important to keep in mind those three aspects of it all, and each of which can have significant impact to your business. One funny example I always give, it's funny now, but it wasn't funny then, I'll tell you, is that one activist once just put a dancing banana image on a Department of Defense website. And it was, he laughed, the dancing banana. But when you think about the impact of that, what it says to the public is that the Department of National Defense can allow a dancing banana on their website. If they can allow that, what else can they allow? So even those silly little ones that were done by some child in his basement, I'm sure, creates a whole bunch of other damage downstream. So it's important to remember that there are different ways to be impacted, not just from the stealing of information. So what can we do about it? Well, step one is to admit that there is no such thing as 100% cyber safe. I will tell you that right now. I would love to say there is. I suppose there could be if you disconnect completely from the internet and you put your tinfoil hats on, you live in your cabins in the woods for the rest of the time, but it's realistically not going to happen to our businesses, especially given the interconnected nature of how we operate today. So we treat cyber like we treat other things in our life, that it comes with inherent risk. And my favorite analogy that I use is fire safety. Like, we of course don't want fires to start in our homes or our buildings, and we of course build our structures to code and make sure we don't have bare wire or open flames or whatever other fire risks you might think of. But at the same time, we also invested smoke detectors to make sure we detect a fire if it does go off. We make sure there's code around having fire hydrants within X number of meters of your house to make sure you're able to respond if the fire does start and you were able to contain it. We have fire extinguishers for that reason. Then we have firefighters within a certain number of kilometers from your house, or in the way cities are structured these days, to make sure that there can be an adequate response. And you have insurance to cover any damage to rebuild. So the analogy actually ties so perfectly to cyber, and that's how we treat cybersecurity. Of course, we are trying to put in the right standards, up front to make sure that we are building our systems securely. But we have to ensure that we are ready to detect these fires, so to speak, or viruses that come to our systems as quickly as possible before they spread. Same principle with a fire in an apartment building or a townhouse complex where one could easily turn into 10 or 15. Same principle in cyber. You try to contain it if it does happen. And the quick response afterwards to put it out, to figure out where it started. And if I could draw a loop around this picture, I would, because often from fires or from cyber events, there are lessons to be learned. You bake that in your processes, and the circle of life kind of continues. So I use that as an analogy to make sure that people recognize you cannot just invest solely in prevention. A lot of vendors might tell you that you can go buy a widget off the shelf and this will prevent this from happening. The truth of the matter is, bad guys are trained to find the weakest link in the chain. And sadly, and I hate saying that people are the weakest link, because that says a lot of bad things about people. But the truth is, they will find just whatever vulnerability is in the system. And we as people are busy and we're distracted and such. And that's why phishing and these types of things are so successful. It's not that we are stupid. We have a lot on our plate. And so we need to make sure that we train our people to do their roles, but also have the right safeguards in place to catch, the cases that kind of fall through the cracks. And you may have heard the term defense in depth or layers or the onion analogy, insert name of analogy here, but it does have to be a series of safeguards. And from what I understand from Aldwin and Jeff, that's the way your program works as well. I promised I would get back to the MGM attack. So MGM, I will just say out of context, obviously casino brand, very lots of money in their pockets, lots of investments in cybersecurity. The way, if you haven't heard already, the way in which that breach happened, despite these gajillions of dollars of investments, the bad actor found the name of an IT person on LinkedIn, just looked him up. His name was Joe or John or whatever it was, called the help desk of MGM, said, "Hey, my name is John. I forgot my password. Can you reset it for me?" They reset it to your typical summer 2023 exclamation mark. This guy logs in. He's now an administrator and goes from there. It literally took 5 minutes, despite, like I said, millions of dollars of technical safeguards, 5 minutes of a human process that got them in the system, and from there did their damage. So it just goes to show you that if an organization is large and is money focused as a casino can get breached, it can happen to anyone. And it also goes to show you that the basic hygiene is often the thing you need to invest in first. I'm a big proponent of not spending $1 billion on a bunch of technology and focusing on, the basics, like training the person to, one of the things we had in government is a password reset would always go to your voicemail of the phone that you already had registered, not to some person on the line or some other safeguard. So you could think of it as more a procedural safeguard than a technical safeguard. It's the same thing my dentist said to me once. He was talking about patients that buy a bunch of water picks and all these fancy things. They don't brush their teeth first, or you don't brush your teeth or you floss before you buy the water pick. So basic hygiene before the fancy stuff, same principle applies to cybersecurity. The other thing to understand is one size doesn't fit all. Like I wish I could tell you, there's a checklist to follow and you're done. That's just not how it works. Mainly because everyone has a different threat and risk context. And sorry to keep going back to my government analogies, but this is where I lived, so pardon me here. But in the government of Canada, we had Department of National Defence like on one end of the spectrum, and we had like Polar Knowledge Canada on the other end. And no disrespect to Polar Knowledge Canada, they do some great work. I think in the Arctic, I'm not sure what they do, to be honest, but I can tell you for sure that they do not have the same amount of sensitive information that our military has. And for that reason, they should not be investing as much in cyber as the military. Now, the question is, what is important to them? So if it is, and I'm making this up because I don't know their mandate as well as I should, if it is polar bear data that you're trying to keep safe from whoever, well, then invest your time and money into that. And the same principle goes, for your business. You folks know your business better than anyone. So it's important to prioritize what it is, that is important to you. And we do this well, in the rest of our lives. You can tell I'm an analogies guy, because here's another analogy that I'm about to drop. Is, at home, I have a safe that is like I don't know, 12 inches by 12 inches. And in that safe, I put my valuables, or what I think are my valuables, whether it be maybe old pictures or family heirlooms or passports, or whatever the case is. But I can't put everything I own in my house in this 12-inch by 12-inch safe. So there's a prioritization exercise that we all do in our lives. We do this regularly without even knowing it. But we don't do very well with cybersecurity for some reason. We have this tendency to just kind of say, let's protect all this stuff the same way. And from that's where it starts getting expensive. And I know the field is very intimidating in general, and all these scare tactics, like I said earlier, all this stuff is happening in the world. We get a little bit frightened by that. The truth is, it has to be a prioritization exercise. Otherwise, you will drop millions and millions for no real, benefit at the end of the day. So pragmatism goes a long way here in cybersecurity, which is what, I just want to make sure we emphasize during the course of this presentation. Because ultimately, and I always joke that I think cybersecurity is just a sexy word for people to say, to cover up that it's really just basic risk management. That's all our jobs are. I still put cybersecurity in my resume because it sounds really good, but truthfully, we are glorified risk managers. And there's nothing wrong with that. That is the nature of the work. And so the way risk management works is that risks are always a function of what is the value of the asset, what is the threat you are facing, and what is the exposure of that threat or the vulnerability in general. And so there is your function of risk. And we do this, again, very inherently as human beings. We all took risks to get to our respective offices today, whether we walked or biked or took transit or drove. There are risks involved in each one of those situations. But we, as good risk managers, hopefully look both ways before we cross the street. We hopefully stayed in our lanes when we were driving, and so on and so forth. And so we just have to ensure we put the right mitigations in place that are commensurate, with the risks that we're dealing with. And so cyber is no different. We all recognize budgets are limited. Even in the government, it seems like sometimes we have unlimited dollars. We had limited cyber budgets sometimes, and some departments had more than others, and you have to really prioritize where you need to put those limited bucks. And recognizing that cyber is one slice of a large business that you folks operate, and you need to spread out your investments accordingly. You cannot just put all your money into one basket, otherwise you wouldn't be able to operate. So the question becomes, how do you prioritize? Well, it's based on risk management exercises. What are your valuable assets? What are your crown jewels, so to speak? And how are you protecting them? Who is after your stuff, and what stuff would they be after first? And how, in that proverbial safe, what would you want to, put in there first before you invest in other things? So I think that's an important aspect to take as you ask questions to your management board, your staff, as you ask questions amongst each other. Are we sure we are prioritizing, the right things? And how do we know that? And the other analogy I'll give that we all kind of deal with on a day-to-day basis, so not maybe day-to-day, but regular, is kind of how you deal with your car at the mechanic. And I'm sure if your mechanic's anything like mine, they will give you a list of 17 things to do. And if you're anything like me, you will ask, what are the things I can put off and what are the things I can do today so I don't die on the way home? And obviously brakes are more important than a scratch on your bumper, for example. So I think taking that lens to your cybersecurity kind of program is exactly what I'd recommend, is really figuring out what is the stuff that is going to keep you in business and operational first and foremost, and the nice to haves, down the road. So it takes a really honest conversation to have that. Otherwise, we end up in the boat where everything's important, and then honestly, nothing's important, because there's no such thing as everything being a priority. Conscious of time, I think a few more minutes I'll go for. I'll take some questions at the end. And so one just personal side of me is I'm fascinated by the human aspect of risk management. So this is just a slide from one of the books and articles I've been reading lately, and that we are just not very good for some reason as human beings in assessing. Oh, sorry, I just clicked twice. Sorry, my fault. I think I'm back. Yeah, sorry. We're not good as human beings at assessing risk for some reason, and it's an evolutionary trait, apparently, from what some of the books are telling me, and that we've evolved to look at immediate risks, the risks that are right in front of us. So when we were cave people and lions were after us, we had to have a sixth sense that we were not going to get eaten that night. And we have a harder time, though, as human beings, looking at maybe more existential risks or risks that are further out. The further they are out, the harder it is for us to kind of quantify them for some reason. And climate change is honestly a great example of this. We've been talking about it for a while, but it's not something that hits home until you actually, and now I think we can see it in front of our very eyes happening, and people are starting to wake up to it. So it's that immediate situation that we're not seeing, with cybersecurity. And the same thing goes with driving the car, for example. I think we all feel safer, or some people feel safer behind the wheel of a car rather than boarding a plane, for example, because we are in more control, yet statistically flying is safer. So I think that this risk assessment thing is something we have to just wrestle with inherently, that we're not great at it. So it's important that we use data-driven information wherever we can to make our decisions. And so, in cybersecurity, it's very much what I find is those that have not been breached are the ones that kind of, it's not going to happen to me, or it's never going to happen to me, or we're not that important. But those that have been breached, it's the same as once you touch a hot stove, you're not going to touch it again. Some of the ones that have been breached in the government of Canada, I can tell you for sure, are some of the most secure organizations in the country now, but it happens after the bad thing happens. So my message is, let's not wait to get burned on that stove. Let's at least try to focus on the things that we know are going to be some of the risks proactively, because it is faster and cheaper to do it proactively than it is after the fact, not to mention the reputational and or financial damage that you may incur afterwards. So a slide that I like to leave with boards as well, and I'll share all these slides, by the way, afterwards, is that you folks are accountable for your, the operation of your business. As we talked about, cyber is an incredibly important part of your business as a business risk. So you have, whether there are statutory or other duties to ensure that the risks are overseen properly. I would include cyber in there. And so for yourselves on the left side of the slide, I'd ask, you have to answer this now, but ask yourselves, are you treating cyber the same way as you treat other risks in your organization? Do you understand your roles and responsibilities when, in particular, when a cyber incident happens? Do you know what you're accountable to do or say in those situations? Are you briefed regularly? And the fact that I'm here today at the board says a lot about your willingness to hear these messages. So I already give you an A+ on that one. But are you getting your regular briefings, and you have a sufficient understanding that you know what the risks to your particular business are, as opposed to the casino risks that I just laid out? Do you have the right governance capabilities internally to make those decisions? And do you have the right knowledge, acknowledging that you don't have to be experts, as Jeff said in his opening remarks, but do you have the right kind of risk knowledge and business knowledge and environmental knowledge to make the right decisions when the time comes? And then similarly, on the right side of the slide, I always leave some questions that you should ask your management. And sorry to put Jeff and Aldwin on the spot here, but you should be able to answer, hopefully, the questions of, is there a clear owner of cybersecurity at the college? Do you understand those crown jewels, or what those key assets are? And are we going to prioritize those at the college? Do you have the incident response plan, and how often do we test it? Going back to my fire analogy, I failed to mention that we all do fire drills in our buildings on a quarterly basis, I think because it's regulated. But the truth is, there's no reason why we can't do the same for cybersecurity. We should be doing tabletop exercises and walkthroughs and making sure that we are ready for when the time comes, because I will I don't have stats to back this up, but I'm pretty sure it is more likely to be hit with a cyber event than a fire. But don't quote me on that one. But I feel like we should be practicing them in the same degree. And then finally, do you understand the impact if these assets are destroyed or modified or unavailable for a certain amount of time? And the last one I like to add, I added recently, was there is so much change in the technology world. You hear about AI. I think you can't go a day without hearing the letters AI. Quantum computing is going to be the next hot thing. Blockchain is another thing you probably hear nonstop. So with all this technology that is out there, are you ensuring, and I'm sure adoption of this technology will come over time in your organization, how are we ensuring that the right cyber risks are being addressed at the same time? You know, AI is a really interesting one, not from a, well, yes, from a cyber perspective, but the main issue right now is the ethical perspective of AI and making sure there's no bias in these decisions. But this is what happens when people start to adopt things early. They tend to forget some of the other checks and balances you want to do. So make sure that you are being proactive as you were even thinking, as when this technology is a glimmer in your eye, that cybersecurity is at the table, as is privacy, as is the, you know, the ethical folks, to make sure that everything is being adopted, you know, securely and safely. And so I'll just close up. I know I'm at my time here at the 20 some odd minute mark. You don't let perfect be the enemy of good. And I like I said earlier, I would love to say I can give you a magic formula to be 100% cyber safe. There is no such thing, but you can take incremental steps, doing that basic hygiene stuff that I talked about, just making sure you get better every day. To me, getting better every day should be the goal for cyber. I think, and believe me, from government, there's a lot of analysis paralysis about, oh my God, let's take 5 years to figure out the perfect thing. But over the course of those 5 years, things change way too quickly. Vulnerabilities grow exponentially over time, and you don't have the luxury of time anymore to think that through. So I would just do your baby steps, day in, day out, keep getting better, keep challenging your staff to brief you on the risks, and recognize that you may have to adapt even in the course of a year. Like the days of a 5-year cyber strategy are no longer. 3 years, I hesitate. At least every year have a chance to kind of reorient yourselves because of how dynamic the landscape is. So I will stop talking now because I did a lot of that. I'm open to any kind of thoughts, questions, or whatever comes next.
Okay, I just, on behalf of staff and council, thank you so much, Imran, for that presentation. A lot of great points, a lot of great advice, a lot of things that hit home that we do, and definitely the human aspect is something we take particular care with. Aldwin's, sending out phishing emails and, testing staff whenever we can. So thanks again for that excellent presentation. Turn it over to Hanno.
Thank you. Nizar? Thank you, Imran, and thank you to others for this. It was an absolutely fabulous presentation and one right up my alley. I do have a question and a comment. One of the things so just by way of a little background, because I'm brand new to the council, I've been the chief executive officer of a couple of high-profile organizations, technology organizations. I was formerly the CIO of North York General Hospital, so I have a little bit of background in this area. I share that not to by any ways of conceit, but more to suggest to you that my passwords are a high-profile hacker target because they enable access to a number of very sensitive databases. And despite the fact that I have a 22-character, I'm not exaggerating, a 22-character password that I create myself, my identity's been stolen twice in my career. And so I share that partly to reinforce what Imran and others have been saying, because the current lingo in the cybersecurity space is it's not a matter of when you will be breached, it's a matter of learning that you've already been breached and figuring out when that would be. So I support everything that's been said. The question I had for the team is, have we done TRAs? Is it a normal practice? Have we particularly highlighted any vulnerabilities? As I'm immediately impressed by the e-portfolio, we are gathering sensitive information on ECE credits and other things and personal information. So is it routine practice for us to do those kinds of things, TRAs and others?
Thank you so very much. Yes, we do it in two ways. We do automated threat analysis on a regular basis. As I said in the briefing, we've implemented a new external vulnerability scanning tool. That is, going back to Imran, that is just one of the many external scanning tools that we have. We also have internal vulnerability scanning tools that are run regularly. Beyond that, we also engage professional assessors to actually come in and look at both external penetration testing and internal vulnerability testing. And the reason why we do it that way is because, exactly as you said, we assume that someone has gotten in. So what we're now testing is, if you've gotten into our environment, what can you get at now that you're here? So we take a multi-pronged approach, the automated piece, but also a managed approach as well, to ensure that we're catching as much as we can. Doesn't mean that we will catch everything. And so we try to layer security as well, so that, for example, our IT folks will have multiple identities. Even if you breach Aldwin, I have zero administrative access to anything. We have a separate identity for that. So we've taken a multi-pronged approach to try and mitigate some of those risks that have been identified.
Thank you. Mark Trudell.
Thanks, Mr. Chair. Imran, thank you so much for your time today and for a very thoughtful presentation. Question to either Aldwin or arguably Jeff. Cyber risk insurance. Would you please confirm the scope and dollar value that the college has in place with regards to risk, cyber-related risk occurrences?
So we can confirm that we do have cyber insurance coverage. The exact limit, we can definitely share that with the council. I don't know if, Jeff, you have that off the top of your head?
Yeah, we have $4 million coverage. So there's different components of the policy, but the overall limit is $4 million, which is much higher than some of our counterparts have. So we've had that for, I don't know, 5 or 6 years. And one of the concerns we're a little worried about, and maybe Imran can talk about this, is whether you see the cost of cyber insurance going up, like dramatically.
If I can just respond for clarification, Jeff. So, to my understanding, if there was a release of confidential medical records, potentially hundreds, thousands of patients, and that the source of the leak was via the college, and corresponding, if the college was faced with legal consequences, civil liability, class action, the scope of our coverage at the present time would address that incident, and if that is the case, the coverage extent is $4 million?
So the coverage would cover that, depending on what the situation is. The deductibles might be different in the coverage, but we can, as Aldwin said, we could share that information if that's something that's needed.
In addition to the overall coverage, our provider also provides assistance with a response as well. So exactly as you thought, if there was a breach, the scope of our coverage looks not just at paying out, but at assisting the college to contain that incident. They will assist with the communication, with the response, with the recovery, and with the restoration as well. Our current provider also has a proactive element to it. So I speak about the multiple vulnerability assessments that happen. Our current provider, on top of our own vulnerability assessment, also runs an external vulnerability assessment on us regularly to identify potential issues that we can address as well. So we do have a full scope coverage for cyber insurance.
Thank you. Ram?
Maybe I'll speak. You see, a lot of information comes through our Citrix system. Are we still vulnerable to cyber attacks? Is it not safe?
So we're always vulnerable. However, one of the reasons why we did deploy Citrix was to mitigate some of those risks. The way that Citrix is set up today is that the information never leaves the RCDSO. Citrix allows you to work with information within the confines of our environment, as opposed to sending it to your personal device where the vulnerabilities are uncontrolled or less controlled, let's say. So while it may be cumbersome somewhat to use Citrix, we do deploy solutions such as Citrix, such as Secure Mail, to mitigate some of those risks that are there. But again, I go back to what Imran has said. Nothing is infallible. So we're always evaluating and optimizing our solutions, but we deploy certain solutions strategically to mitigate those risks.
Dan?
Yeah, I wonder if I could direct a question to Imran. You had a slide that was questions that the board should ask. And I wonder if you could elaborate a little bit on that in terms of what are some things that a board should do? So the questions are important, but some of the real concrete things that a board should be doing to protect against cyber risk.
Yeah, so I think number one is the board themselves, like you will not have the data that Aldwin and Jeff has. So I think what it is having the regular updates of what like asking for proactively to come back, hopefully, sorry, Aldwin, to put you and Jeff on the spot here, but to come back with data that talks about the latest vulnerabilities, talks about the progress made over the last quarter, for example, asking pointed questions about the risks that remain and where the priorities lie. It's an oversight role more than anything else. And then the follow-up to that would be, it's a lot of that, what happens when an incident happens? Like, do you know when you're engaged? Do you know what your role is when it happens? If it was hypothetically a ransom and there was a pay or no pay decision, is it the board that makes it? Does someone else have the authority to make it? What considerations do you need? What are the communication elements that do you have to go about, make a public statement? Who does that? So some of the who does what and when that the board should at least know. I think the main thing to answer your question ultimately though is getting the data you need to make those ultimate risk management decisions. And it's a balance, right? Especially when it comes to investment decisions. If your risks are very high in this category and low in, let's say, HR, well, you'll prioritize differently and vice versa. So I think it's just more making sure you have the right data and holding, your folks here accountable to kind of bring it to you on a regular basis. I'd say the boards that don't do, I'm going to flip the question around to say, the ones that struggle are the ones that have a cyber presentation like this once every 3 years and just kind of check a box because they're doing it because it sounds like the right thing to do. It needs to be a regular part of your cadence, and just as I'm sure financials are on a regular basis, same kind of principle.
Thank you for that. I see no other speakers on the list, so Imran, I would like to take this opportunity to thank you so much for giving your time and your entertaining knowledge and expertise, and thank you to Jeff and Aldwin for bringing this presentation to Council's attention. So thanks again, Imran. Have a great afternoon.
You too. Thanks so much.
So, Council, the next item relates to the emergency class of regulation, a requirement for all Ontario Health Colleges, and I'm going to turn it over to Harinder at this point in time for some thoughts as we begin to discuss this item.
Thank you, Hanno. I just want to begin this item with thanks to the working group for all of their advice and work this summer. Nancy DeSanto, Ellie Fisher, Brian Smith, and Sama Solomon. Thank you. Your work was much appreciated. Staff has always helped ensure that we were able to make so much progress. Thank you particularly to Andrea and Hillary. In addition to the consultation that the college posted, our working group discussed how we would open the class. We worked on a resource package for emergency registrants, and we developed the parameters for supervision. And I will hand this over back to you, Hanno, now.
Thank you. And Council, the material in your package that relates to this item can be found on pages 184 to 195. This is an item for Council's decision, and I'm going to be turning it over to Andrea to lead the discussion. Andrea, please.
Great, thank you, Hanno. I have a short slide deck that I'll just give Angelo a chance to bring up. Thanks, Angelo. Okay. So I'm going to keep this fairly brief. I have with me today, to my direct right, Sarah Yoon, from your Weir Folds, who's been instrumental in supporting us in this work, and she's actually drafted the bylaw amendments that are in your package today. And of course, here today also is Hilary Bauer, our manager of registration, who's been an important part of our team in just bringing all of this work forward. So I will offer just some brief comments to refresh your memories about context. Why are we talking about this? What are the specific decisions for you today? So Angelo, next slide, please. Thank you. So with that in mind, it was mentioned earlier, but the RCDSO now has a finalized regulation that creates an emergency class of registration. And when I mean finalized, I mean the regulation itself has been approved. The class isn't open, but we have that legal tool in place right now that gives us that ability when and if the time comes to open it. So that regulation, you saw it last in early August at the special meeting of council. It was signed and sealed, which is a process that the ministry asks us to undertake to finalize the regulation. So that was done by Harinder and Dan August 11th, and then it received cabinet approval August 31st. So those are sort of the anchor points. Just as a reminder, this work has really been directed by the Ministry of Health, and these are each regulated health profession that is subject to the RHPA, so 26 colleges, all have the same type of regulation in place, and all of those, to the best of my knowledge, were also approved August 31st. Okay, so there's a very strong component here of the ministry. They've been an active partner with us in this work. So next slide, please, Angelo. This is a very brief recap. It doesn't do the regulation justice, but I just wanted to put a few points here to remind you. The class of emergency registration can be opened either by the Minister of Health or Council, U.S. Council. The regulation specifies a number of requirements that applicants would need to meet in order to get an emergency class of registration. I've highlighted one here, just simply that for this class of registration, applicants would be exempt from one certification exam, the NDEB certification exam. Applicants would have to practice under supervision. So you saw in the briefing note, supervision's been a key element of work that the working group's been looking at. It's a short-term class. This is really distinct from other classes of licensure. This is intended to be responsive to an emergency. So it can be open for 1 year duration. It could be closed earlier than 1 year. It could be extended beyond a year. It allows for flexibility in terms of what is going to be needed to respond to the emergency in front of us. Okay. Council closes the class, though. Okay. Next slide, please, Angela. So moving to implementation, as Harinder noted, we have had a really fantastic working group assisting staff over the summer, and we've had great support from Sarah on a number of implementation issues. And I've just, in the gray boxes on the slide, I've captured some of the high-level categories. In no way does this do justice to the work and the depth and breadth of the work that we've been engaging in, but just to give you a snapshot, we've been looking at, documents to support council decision-making, when to open the class, when to close the class. We've been looking at and are about to embark on work to support the supervision requirement. So what are those components of supervision? What should it look like? And then certainly, last but not least, most certainly, we have been looking at enabling bylaw amendments, and that's the piece that's in front of you today that I'll just talk about a little bit further in the next slide. So there are two amendments before you today. They both relate to fees. You can find the actual legal language if you're open and interested to see the detail. It's in appendices A and B of your package. One of those appendixes has the actual black-lined, red-lined
language so you can see specifically what's changed, and one is a clean copy if that's easier. In summary, there are two things that those amendments will do for us. One is to create a fee that emergency class registrants would pay, both the initial time that they're registered, and if that emergency lasts beyond a year, it would be an annual fee. And then there's amendments that allow us to waive an application fee in a very specific circumstance. So I'll go a little bit further on each of those. So Angela, if you could advance the slide. So in the first category, when we're talking about an annual fee, I've put here the sections that are relevant. And just a couple of notes here. The intention really, and we got good direction and conversation from our working group. The intention in setting this fee is to really ensure that our emergency class registrants have liability coverage. Now, given the conversation this morning, and just to relate it to that, we have framed this based on today's costs of PLP coverage. Certainly, depending on what your decisions are, we can go back and change this bylaw as needed, depending on what you ultimately decide this college will do with that. But we wanted to start with the idea that we felt it was important that PLP coverage be in place. The specific fee of $1,000 is intended to be cost recovery just for that liability coverage. And notably, it is a reduced fee compared to other categories because we're not charging any of the, what I would call sort of the regulatory elements of that cost. It's just to cover the liability coverage. Next slide, please, Angelo. The application fee waiver, you may remember this from our August 3rd meeting. It is a requirement in the regulation that if we have someone registered as an emergency class registrant and the emergency ends, so they're no longer going to have that emergency class certificate of registration, if they wish to go on to apply to another class of registration like a general class or specialty class, we would waive an application fee that would typically be in place. So it's a small administrative fee, but this was seen as an important sign by the ministry to really smooth that pathway, to make it easy for individuals who've assisted in emergency to then seek more permanent licensure with the college. So we've got an amendment, and the section is there that allows us to do that and to meet that regulatory requirement. Next slide, please, Angelo. So these amendments are before you. The question you're being asked today is whether you approve them in principle. We have an obligation with these bylaw amendments to circulate them for feedback. So we would do that circulation as we would other consultations. They would be available to the profession, to the public, to organizations to give us feedback on those changes. If you're agreeable to have us go forward with that circulation, we would do that following today's discussion, and we would be looking to bring this back to you in December with an overview of any feedback we receive, an overview of any amendments that may be indicated to respond to the feedback, and at that point in December, we'd be asking you to make a final decision on the amendments so that we could fully embed them into our bylaws. So I think with that, Angela, if you just advance, I sort of jumped ahead here to talk about next steps. So on the bylaw, again, if you're agreeable, we would get the consultation organized and have that underway. Meantime, all of the other implementation work is proceeding. We have another working group meeting the end of October where we're looking to present a number of draft documents to our working group to get direction. At December's council, as I said, we'd bring a final bylaw back to you with any feedback, and we'd also update you at that point on our implementation work. So that gives you a little bit of a picture of the next couple of months. I think I'll stop there. this is what you're being asked to decide upon. There is a motion that we can bring up when the time is right for that. We're happy to help with any questions you might have. So Hannah, I'll turn it back to you. Thank you.
Thank you so much, Andrea, to you and to the working group for all the work that you have done to get us to this point today. And at this point in time, I am going to look around to see if there are any people who have questions or comments, either for Andrea, for Sarah, or Harinder in terms of what we've just heard. Jamie.
Thanks, Mr. Chair. Andrea, would our process be similar to the other health agencies in terms of how they view the new bylaw? Are they doing the same canvassing of various individuals?
Sorry, Jamie, do you mean in terms of circulation?
Yes.
It's my understanding, and Sarah can correct me, but yeah, it's my understanding that when making a change like this to bylaw, there would be an expectation you'd circulate any bylaw amendments. So yes, that part would follow a similar process. Would you add anything?
Andrea is absolutely correct on that. That is an obligation of all our HPA colleges under the Regulated Health Professions Act to circulate to members and other stakeholders certain bylaw amendments. So anything related to fees are always circulated. And then at this meeting, the bylaw amendments are being approved in principle. So that's where you see that language, which means that you approve what's here pending further feedback, and then you'll receive all that feedback in December and make a decision to finally approve. So that's a process that's set up in the Act.
Thank you for that answer. Aaron? Aaron, could you put your mic on, please? Thank you.
Thank you. I have a question. Now, what is the approximate regulatory cost involved in processing an application for a registrant in this class? So that would entail receiving the application, examining the credentials, making a decision on it, and then with this registration class, there's also supervision involved, which would entail some cost as well. So do you have an estimate on what that would be and what the financial impact would be if we're not asking for any kind of cost recovery in this particular realm and just charging the cost of PLP?
So I think in terms of supervision, we still have to work out some details, Aaron, in terms of how that would work. So if there are costs associated, we have some decisions and some back and forth to go through, and we're going to be seeking some expert advice on that from others and from colleagues who've done that work. So the supervision piece, I can't give you detail today because I think there's more to be determined, and we're going to hope to come back with a more comprehensive model and guide on supervision. In terms of the regulatory costs, I'm assuming there you're talking about things like if there's a complaint and other sort of elements. Is that, or are you talking about the actual processing and application?
Mostly the regular processing. And that's under the assumption that there could be a complaint. Hopefully there wouldn't be, but there are base costs involved in getting somebody registered.
So I just want to clarify, and again, I'll look to Sarah and Hillary to help me. But the waiver that we're talking about in this bylaw amendment is not associated with the emergency class application. It's post-emergency. If an emergency class registrant wants to seek another form of licensure, that's when we would waive the application fee.
Thank you. I was wondering, though, more in regards to the $1,000 registration fee.
Oh, I see. You're talking then about, sorry, so the $1,000 is intended to cover the PLP coverage. So is that, so maybe just help me, like what can I help you with there?
Yeah, so my concern is that if we're registering members at cost for only PLP, if there's an additional cost involved in doing that, what the financial impact could be. If we have an emergency and suddenly we're registering, I don't know, 100 or 1,000 applicants under this class,
Yep.
and we're not charging fees to help recover that cost?
So again, we are, I think, intending to charge an application fee associated with the emergency class license. So that would cover sort of processing of that application. We haven't contemplated charging what I would call more broadly regulatory costs there. And I think in some ways it's difficult to sort of determine what those even might be, because the duration, there can be great variation in terms of the duration that the class would be open. So depending on the nature of the emergency, and just as a quick refresher, the guidance and direction that we and other colleges received from the ministry was to really construe emergency quite broadly, and avoid a narrow definition in regulation. So that's why you don't see it defined in regulation. What that does, though, is it really opens up a broad range of possibilities as to the type of emergency we may have, how long it may last. So I think it's a little bit tough to even forecast, like, what might the cost impact be. I can tell you, we've done, and Hillary's led this, we've done a little bit of looking around at what are other colleges doing, and there's a real range of approaches. Some colleges have not charged a fee, so that would be, and keep in mind from our conversation this morning, the majority of other colleges in Ontario don't have a liability program. So some have not charged a fee. Some have charged a fee. So you're really seeing different approaches, and I think it's just a challenging thing to try to anticipate what the expenses may be. So I don't have a really concrete answer for you, Aaron, because of that, but I hope I've at least given you a bit of a frame as to how we've been thinking about this.
Thank you, Andrea. I know that Harinder would like to say something at this point in time, please.
Thank you, Hannah. Let me clarify, Aaron, what this is all about. Let's say the emergency class candidate pays $350 for registration fee, administrative fee. And then within that 1 year, he or she passes NDB examination or equivalency process or whatever, and wants to convert that license into the regular license. They will not pay that administrative fee again. That's what it is all about. Is that right, Andrea?
Could I jump in and clarify one other point? Is that okay? I didn't know if you saw my hand over here.
Yeah, please.
Thank you. Just to clarify the first part of your question, Aaron, and Andrea mentioned this. So applicants would be required to pay an application fee still based on the current proposal before you, and that would be $150 specifically, and that's consistent with our other short duration classes of license. So it's the $1,000 annual fee, so to speak, plus the $150 application fee, with the intention that would cover the initial processing of the application to get the license.
Thank you. Dan?
Yeah, sir, just to add one more comment. If you think about this in terms of what the application fee goes towards, it goes towards the staff time, essentially, to review the documents that have come in for the individual. In theory, when they are going from having an emergency class certificate to the next level of a full certificate of registration, the review of their documents becomes less. So we don't have the costing. We haven't done costing per application, but the staff time and involvement in that second phase is less than the first phase because we've already looked at the source documents. So I think there's a relative issue here in terms of the time that it takes to look at the second application to go on to the independent certificate.
Thanks for that, Dan. Nalan?
Yeah, thanks, Andre and team, for work to date. It seems to me that most of the fee that we'll be charging will be to cover the PLP component of the fee. It's of registration. It's quite possible that we won't be in the PLP business in the years to come. And so I wonder if it's prudent at this time to broach the topic with the ministry that, to expedite things in terms of emergency, maybe they should be covering part of that PLP fee.
Sorry, Nellen, so you're suggesting that the ministry to cover the PLP costs? Is that your point?
I mean, or just bring up the topic, because this whole emergency class certification is meant to, there's a time component in the, when there is an emergency, we want to be able to register people very quickly. And if we're no longer offering PLP in-house, that may be a barrier for people to get in. So perhaps if the government was covering that, even we broach that topic now instead of waiting for the emergency, is that prudent?
Thanks. I think, Andrea, do you want to respond?
Well, I don't know if Dan wants to start.
Dan was going to say something, but.
Great. No, go for it.
Yeah. First, Nellen, and I appreciate your sentiments based on the discussion this morning. I think we have to be realistic that this morning launched a process to explore options. So we are still providing PLP and will for many more months until we sort this out. So we have a challenge right now to deal with in terms of how to structure this if there was a situation where the class of certificate was invoked next week or 1 month from now. So we have to deal with the here and now. And I think to your point, while I don't expect the ministry would entertain the thought of paying for that part of the registration fee, it is a part of the registration fee. So we happen to be saying that normally under other circumstances, an individual would pay $29.95. But in this case, we're saying the individual would only pay the cost of the liability protection, but not the other $19.95. And so that's how we're approaching it. And I think trying to make sure that we've got all of our ducks in a row with bylaws in place in the event that there was some emergency that was declared, and we're ready to go.
Thanks, Dan. Sarah?
Thank you. Just to add to Dan's comments, right now, today, on September 21st, 2023, when you're considering this motion, PLP is part of the RCDSO mandate, the college's mandate. So as a result of that, we are looking at this bylaw amendment through that lens. If in the future PLP is restructured completely differently, then the fees would be reviewed, and it wouldn't just be the emergency class registrants' fees that would be reviewed, it would be across the board. So that is a great discussion to just flag potentially for the future and would be part of any implementation plan for PLP alternatives. But right now, we're obviously assuming that it's here, and it is. So hence the annual fee has been set at an amount that is lower than sort of a general class annual fee, and that's partly to align with the ministry's priority in having the emergency class be accessible and kind of working in the public right away, or removing as many barriers as possible. So there's been a balance there between covering liability costs and then also really working towards the spirit of the emergency class to begin with.
Thank you, Sarah. Ram?
A very good presentation, Andrea. Just a question. The emergency registrants have to be supervised, and supervision is a big component in this. So I was wondering what sort of compensation the people who supervise as a member.
Thank you, Ram. So the costs of supervision and how it will work are just details we haven't yet worked out. So we've started some and had some good conversations at the working group about a range of issues. Cost would be one, but also who should be a supervisor, what type of supervision is required. Those are all things we've still got to work out. So we're going to be embarking on some work. We're going to do it in partnership with our colleagues in PCRA so that we have a really cohesive approach to supervision across the college. So more to come. I don't have an answer for you today. Just know that it is something we're going to look at, and we'll come back to you with more detail.
Thank you for that. Angelo, if I could ask you please to put motion number 3 on the screen. Thank you. And council, what you're being asked to consider is that council approve in principle changes to bylaw 18 fees as presented in Appendix A, and that the proposed amendment be circulated to members and stakeholders for at least 60 days. Anthony, I saw your hand up first, so are you making that motion, Anthony?
Correct.
Thank you. Seconded by Christina. And council, this requires a 2/3 vote. So if you're in agreement, I'm going to ask you to raise your hand, but leave your virtual hands up so that Angie and I can count. We need a minimum of 14 people in agreement in order for this to pass. Okay, thank you for that. 20 are in agreement. That motion has passed. So Andrea, I don't want to put you on the spot because we were supposed to break now, but what I'm going to ask is if we can go to the strategic plan, and if I could ask you, if possible, to sort of do it in 15 minutes so that we could aim for a 2:30 break.
Absolutely. I can do it in less.
Thank you.
I'll be very brief. So I'm looking in your package at page 162. So this is you'll recognize this is a standing report that we do every council meeting on the strategic plan. It's here for your information. Part of this as Appendix A is the strategic plan itself, just as a refresher, and then Appendix B is our council dashboard on the strategic projects. So what I would draw your attention to, there's background here just to serve as a refresher as to when you approved the strategic plan, our pillars, etc. What changes over each meeting, you've probably gathered this, is the charts and the description of each project. And so I'm looking now, starting at page 163, the bottom of 163. You'll see there a chart project by project. And our goal is to give you an at-a-glance status of these projects. So I won't read everything, but I just want to draw your attention to, in the chart, the column on the far right gives you an update that's happened since your last meeting. Okay, so these are the activities that our project managers have been working on. All of the projects are underway. You can see we're making some really nice progress across all of them. Maybe to just pull out a couple of highlights, I'm looking first at the College Standards project. You can see here highlighting work done to rescind the COVID-19 guidance. And then work that is underway right now on a new draft standard on virtual care. You looked at this at your last council meeting. It has gone out for consultation. You'll see that again in December. If we scroll down, an update on access to care, you also have a separate briefing note on access to care as information. Our project manager, Michelle Cabrera-Gali, has outlined here a snapshot of that progress, and you can see a little bit more detail in the briefing note itself. So you can see here we've made some nice progress in terms of information sharing, education. We've done some collaboration on CE points. The RCDSO Connect event that Dan spoke about earlier will have a focus not just on EDI with Indigenous issues, but specifically on access to care. If we move to the next one, service experience, our project manager, Michelle Tremblay, has outlined here some important progress made related to French language, related to our phone system, and our accessibility training under the AODA statute. Next, same with Michelle Tremblay as well. She's leading our project on equity, diversity, and inclusion. As you know, we've had different events over the course of the year. You see here some really nice highlights that Michelle's covered here about both discussions and efforts internally to the CPSO and then things that we're doing externally in terms of resources, multilingual brochures, and so on. Moving a little bit further, and I'm going through this quickly by design because I know you can read all of this and I know you've likely done so. The next one is governance review and modernization. We have Dana Simon and Laura Thacker. You'll hear from Laura in a little bit, talking about governance. And you'll be getting into more detail on that later in the meeting in terms of the inaugural governance committee. But some great work done there to support that. And last but certainly not least, we have our project on practice models in corporate dentistry. This has been led by Michelle Cabrero-Gali. She's done some really nice work in compiling research on the different models that exist out there, really helping us form a strong foundation of knowledge to understand the landscape, and working now on a lit review in jurisdictional scan. So aside from that, I'll just briefly draw your attention to our council dashboard. It starts, this is for strategic projects, so this starts page 171 of your package. I won't go through these all, but our data scientist, Eric Dessaw, who you heard from last meeting, works directly with our project managers to develop KPIs and then populate these. And you can see here, our goal is to really demonstrate accountability to you, so you have a clear picture of what we're working on and how it's going. So again, I won't go through all of these, but our intention is to make these metrics clear, accessible, and to really make sure that you're informed as to the progress being made. So Hannah, I'm going to stop there. I'm obviously happy to take any questions, and I know some of our project managers are here today and they can certainly help. Thank you.
Thank you very much for that, Andrea. Judith, I see your hand up. Oh, okay. So now if people do have questions for what Andrea just talked about. Okay. You obviously did such a great job, Andrea, that no one has any questions to ask of you.
Silence is golden. I like
Yes.
it. It's good.
So thank you all for that. It is now 2:24. I'm going to propose that we take a 15-minute break, so we will reconvene at 2:39. Just a reminder to council members to please turn off your videos when you step away from your computer. And from those of you who are watching today's meeting on YouTube, we will be stopping live stream, but will resume just before 2:39. Thank you.
Oh yeah, you did get it from Eric. Sorry.
We'll start back with the Thank you and welcome back. Just a heads up before we begin with item number 11 on our agenda, I just want to let council know we have a hard stop at 3:30 for an in-camera session due to the guest that will be speaking to us at that in-camera session. So we will move through the agenda and get as much done or get it all done prior to that. But whatever is left, we will come back from the in-camera session and complete that part of the agenda. So I just want to let you know, hopefully I'm not going to cut anyone off mid-sentence, but I will be monitoring the clock, and at 3:30 we will move to in-camera session. So we're looking at item number 11 on the agenda, Governance Committee. This item is an important step forward in governance modernization that has been in progress for several years now. The materials for this item are at pages 196 to 267 of your meeting package, and this is an item for decision. I'm going to turn it over to Lara Thacker, Governance Specialist, to walk Council through this note. Council, there are 9 motions related to this item, and we will vote on them all separately. It's going to be a little onerous, but when we hit that part, we will organize ourselves and get through that as quickly as possible. So, Lara, I'm turning it over to you, please.
Thank you, Hanno, and just wait for the deck to come up. Good afternoon, everyone. I'm pleased to be before you today to present on proposed bylaw amendments to establish the new Governance Committee, as well as some consequential and housekeeping amendments. I know you've read the briefing note, so I won't repeat anything in it, but I will briefly summarize the proposed amendments for you today in the sequence that they appear in your package, grouping bylaws to the extent possible to be efficient with your time. I'd like to thank Sarah Yoon for drafting the bylaw amendments before you. I'd also like to acknowledge Dana Simon, who brought considerable experience and expertise in drafting these amendments. Next slide, please. Today, Council is asked to consider and approve proposed bylaw amendments to bylaws 1, 2, 4, 5, 7, 8, 9, and 10, and a new bylaw 9B. In the interest of time, I'd ask that you please defer your questions until I've concluded my presentation on each bylaw or group of bylaws. Then I will turn it over to Hanno to facilitate discussion and present the recommendations and motions on that particular group. Once the vote has taken place, I'll move on to present the next group of bylaw amendments. As you've heard in previous presentations, next slide, please. As you've heard in previous presentations, there have been a number of drivers for governance modernization work. The Government of Ontario's vision for governance and regulatory reform includes establishing a nomination and selection committee to oversee the selection of council and committee members. Gaps and overlap have arisen from several RCDSO bodies overseeing governance functions, highlighting the need to establish a consolidated approach. Council has approved in principle terms of reference for the new governance committee. Council has also approved composition of the governance committee in principle. Establishing a governance committee is one of the first governance review and modernization strategic projects assignments, as this body will determine the priorities and work plan for many of the other project components. The governance committee will report on its work to Council, who will make all decisions about governance changes recommended by the committee. Before you today are bylaw changes that establish the governance committee, sunset committees with redundant governance functions, and also include some non-substantive housekeeping amendments. All proposed bylaw amendments are shown in the appendices in both redlined and cleaved version, include in your package on pages 200 to 267. Today, Council will consider and be asked to approve the proposed amendments. As Hanno previously mentioned, there will be 9 proposed motions. Next slide, please. The proposed amendment to Bylaw 1, included on page 200 of your package, pertains to a new definition of subject matter expert, which has been drafted to be general and will be, if passed, will apply to the bylaws as a whole. Subject matter expert means an individual with specific expertise required for certain committees, as set out in the bylaws. The new proposed governance committee includes subject matter experts in its composition. You'll recall that similar external subject matter experts have been appointed in the past, for example, the Eligibility Review Committee and the former International Trade Committee. Moving forward, there will potentially be a need to appoint committees other individuals with specific subject matter expertise that may not be present on council, particularly if legislation is passed separating council and committees. These experts are external to the college, so they're individuals outside of RCDSO's council, committees, and staff. The eligibility requirements for this new category on committee members are set out in Bylaw 9B, which I'll present later on. The particular expertise required of a subject matter experts for a specific committee can be included in Bylaw 4, and that's what we've done with the Governance Committee in its terms of reference. I will now turn it back to Hanno to facilitate discussion and present the motion to amend Bylaw 1.
Thank you for that, Lara. And before I do that, I just want to give you a heads up. As we had said, we are going to be looking at 9 motions. Since these are all bylaw changes, they all require a 2/3 majority. Angie and I will be counting, so that means each motion, in order to pass, requires a minimum of 14 people in favor of. I am not going to repeat every time for the 9 motions that are coming up that it's a bylaw amendment and it requires 2/3 majority. I'm saying that up front now. Once the motion has been read and we've had questions or discussion, I will ask for a seconder and a mover as always. And again, I will ask you to keep your virtual hands up and raised until Angie and I can do a count. And then I will tell you when to lower them and we will move on. Some of the motions Lara will deal with individually, but a few of them will be grouped. So even though each motion will be voted on separately, that doesn't mean that Lara is going to be individually speaking to each one. So if we could have motion 4A on the screen, please, Angelo. Thank you. And that motion is that Council approves amendments to Bylaw 1 as set out in Appendix A. Ram, Ram is moving that motion, seconded by Ellie. Now, I am going to ask, are there any questions about that motion that were needed? In that case, that is the motion we are voting on now. If you are in favor, please raise your virtual hand and leave it raised until I ask you to lower it. So, Christina, you have not voted yet. Are you going to vote in favor of, or are you purposely not voting in favor of? Oh, perfect. Okay. That's unanimous. Thank you very much. That motion has passed. And Lara, I'm going to turn it back to you now, please.
Thanks, Hanno. Amendments are also proposed for bylaws 2, 4, and 5, which I will speak to as a group, and you will find on pages 202 to 212 of your package. The bylaw 2 amendments are brief and fairly straightforward. They simply replace the executive committee with the governance committee with respect to the nominations function. The proposed amendments to bylaw 4 establish the new standing committee on governance. The bylaw 4 amendments also sunset 3 committees: the elections committee, the Legal and Legislation Committee, and the Eligibility Review Committee, known as the ERC. The Governance Committee will inherit the duties of the Elections Committee and the ERC. Next slide, please. The Legal and Legislation Committee has not met in more than 4 years. Current practice is to bring proposed bylaw amendments to Council through the relevant subject matter committee. As mentioned previously, the bylaw 1 definition of subject matter experts is more general, and therefore the Governance Committee composition provision, Article 4.18.1, has been drafted to specify that the Governance Committee shall be composed of at least 2 subject matter experts with expertise relating to professional regulation and governance. Next slide, please. Included are minor amendments to Bylaw 5 to give Council flexibility with respect to filling vacancies on committees as they arrive, changing phrasing like shall to may. There are also recommendations for non-substantive housekeeping amendments, and you'll see these changes detailed in red line appendix at pages 209 and 210. I'll now turn it back to Hanno to facilitate discussion and present the motions for bylaws 2, 4, and 5.
Thank you. So at this point in time, Angelo, if I could have motion 4B on the screen, please. And 4B is that Council approves amendments to Bylaw 2 as set out in Appendix B. So I'm looking for a mover, please. Moved by Jamie, seconded by Mark Trudell. And again, if you are in favor, please raise your virtual hand and leave it up.
Sorry, Mr. Chair, discussion?
Oh, I'm sorry.
Discussion?
Please.
It was very quick, Lara. I just wanted to make sure I completely understood the red line modification to the definition of quorum. This, for my colleagues, would be on page 206, I believe, 4.18.3. Of course, I understand the definition of quorum being a majority. What I'm not following is perhaps the wording that begins after however. However, no meeting of the Governance Committee shall be required to conduct candidate interviews, which may be conducted by one or more members of the Governance Committee. Can I just have a slight clarification there, please?
Sure. Thank you for your question, Nizar. One of the primary functions of the new Governance Committee will be to conduct competency-based assessments, particularly of council candidates and potentially others. These are typically more operational in nature. It may not require the sort of firepower of a completely, a committee with quorum. It could be a panel with 1 or 2 committee members that sit and conduct those interviews. Is that helpful?
So if I'm in a layman's interpretation, Lara, this bylaw modification assists the Governance Committee from having to be restricted to hold all of those in full committee and empowers us to conduct that activity as we so choose, perhaps as a panel or separately.
That's right. It gives a little bit more flexibility.
Okay, perfect. Thank you.
And thank you for that question. So, again, if all those in favor of that motion, please raise your virtual hand and leave it up. Okay, 20. And that is carried unanimously. Thank you. That motion is carried. I would ask that you now all lower your virtual hand. Now, Aldwin, I'm going to ask you to please, Angelo, please put up motion 4C. And before I ask for a mover and a seconder, I am going to ask if there are any questions for Lara about motion number 4C, that Council approves amendments to Bylaw 4 as set out in Appendix C. Okay, seeing none, now I will ask for a mover and a seconder. Moved by Anthony, seconded by Vivian. All those in favor, please raise your virtual hands and leave them up. 21. Okay, and that is carried unanimously. Thank you. Please lower your virtual hands. And the next motion, please, Angelo, which is motion number 4D, that council approves amendments to bylaw 5 as set out in Appendix D. And again, before I ask for a mover or seconder, are there any questions? Seeing none, now I will ask for mover, moved by Amelia, seconded by Peter. All those in favor, please raise your virtual hand. Judith, are you voting? And, okay, thank you. And that is carried unanimously as well. Thank you, and you may lower your virtual hand. And now I'm going to turn it back to Lara for the next set. Thank you.
Thanks, Hanno. The bylaws 7 and 8 proposed amendments are included on pages 213 to 239 of your package. They replace functions of the former Eligibility Review Committee and Elections Committee with the Governance Committee, for example, election duties such as breaking a tie by lot. Amendments are also included that add the option for the Governance Committee to engage HR and DEI consultants in addition to legal consultants for certain matters. Other minor amendments allow for flexibility and timeliness of reporting election results. Included are non-substantive housekeeping amendments, which you can see in the redlined versions on pages 219 and 220. And I will now turn it back to Hanno to facilitate discussion and present the motions for bylaws 7 and 8.
Thank you. So Angelo, if I could have motion number 4E on the screen, please. And before I ask for a mover or seconder, are there any questions for Lara about motion 4E? Seeing none, Council, we're asking you to approve amendments to bylaw 7 as set out in Appendix E. I'm looking for a mover. Nazir, seconded by Christina. All those in favor, please raise your virtual hand. And that's carried unanimously. Thank you. Next, if I could have motion 4F on the screen, please. And again, before I ask for a mover or a seconder, are there any questions about that motion? Seeing none, could I have a mover and a seconder for motion 4F, that council approves amendments to bylaw 8 as set out in Appendix F, moved by Aaron, seconded by Daniel. All those in favor, please raise your virtual hand. And that is carried unanimously. Thank you. And now I think I'm turning it back to you, right, Lara? Okay, good. Thank you.
Thanks, Hanno. Proposed amendments to bylaw 9, now numbered 9A, are included in your package on pages 240 to 255. These amendments replace nomination functions of the Executive Committee with the Governance Committee for forming committee slates to recommend to Council. Included are related amendments that allow for flexibility in procedures, such as the addition of targeted recruitment for a non-council committee member where needed, and discretion as to whether or not to fill a vacancy on a committee, and the option of an abbreviated application procedure for vacancies. Non-substantive housekeeping amendments are also included that you can see on page 245. I will now turn it back to Hanno to facilitate discussion and present the motion.
Thank you. So Angelo, if you could put motion 4G on the screen, please. And before I ask for a mover and a seconder, I will ask if anyone has any questions. Nazir?
Again, I wanted to just always ensure I understood the intentions. There's a clause around irrevocable resignation. And in all my experience, this is the first time I've seen this. So I just want to understand the intention behind having a bylaw clause for irrevocable resignation. It's 9A.3.3 on page 242.
Sarah, can I ask
Sarah,
you to
sorry.
weigh in on that?
Sure. Could you please repeat the provision,
Of
the
course.
section number?
So,
I'm sorry.
and if it's so minor, please, I didn't mean to interrupt, but the title of the bylaw subsection clause is 9A.3.3 on page 242, and it states the title is resignation irrevocable. The resignation of a non-council committee member is irrevocable and may not be withdrawn or rescinded. And
Sure.
so I can't imagine a situation where that would happen.
Sure. So I think that just provides some clarity to the process. For clarity of discussion, this is not a section that is being proposed for revision or amendment today, but has been in existence. But for our purpose of education, 9A.3.2 essentially sets out that when a non-council committee member wishes to resign, they will provide written notice, and it sets the date and when that would happen. So either it's the date set out in the written notice or when it is received by the president, vice president, or the registrar, whoever it may be. And so 9A.3.3 is just clarifying that once a non-council committee member submits that resignation in written notice, that's it. So it's a serious matter, and it's to just provide a lot of clarity as to what the non-council committee member means to do. So if you're sending written notice, that means you are no longer going to be part of that committee, and as a result, there will be a vacancy.
I see. Thank you.
Thank you. So Angelo, if we could see that motion on the screen again. That council, this is motion 4G, that council approves amendments to bylaw 9 as set out in Appendix G. I am looking for a mover now. Moved by Ellie, seconded by Christina. If you are in favor, please raise your virtual hand. Okay, is it? Okay. Peter, are you going to vote? Oh, okay. Well, if that's carried unanimously. Thank you very much. You may lower your virtual hand. And Leah, I'm turning it back to you now, right?
Thank you. As previously mentioned, a new bylaw, 9B, has been drafted to establish subject matter experts as a new category of committee members. This is needed as SMEs are included in the composition of the new governance committee. This new bylaw can be found on pages 256 to 263 of your package. The proposed revisions include basic eligibility requirements for SMEs. They set out that an application is required and includes simple removal and vacancy rules. The provisions give the college flexibility in its recruitment for SMEs and mirror provisions in other bylaws related to committee members for consistency. I'll now turn it back to you, Hanno, to facilitate discussion and present the motion.
Thank you, Lara. So Angelo, if we could have 4H on the screen, please. That council approves the new bylaw 9B as set out in Appendix H. And before I ask for a mover or seconder, I will look to see if there are any questions for Lara about that motion. Thank you. Seeing none, could I have a mover and a seconder, please? Moved by Nowlan, seconded by Anthony. All those in favor, please raise your virtual hand. And that is carried unanimously. Thank you. You may lower your hand. And Lara, I'm turning it back over to you again, please.
Thanks, Hanno. The bylaw 10 amendments are included in your package on pages 264 to 267. They clarify that the remuneration provisions in bylaw 10 apply to subject matter experts on committees. This creates a clear and transparent understanding of how SME committee members will be remunerated, which is the same as dentist committee members or chairs. This does not apply to working group or task force members, which are ad hoc in nature and flexibility may be required. I will now turn it back to Hanno to facilitate discussion and present the motion.
Thank you. So, Angelo, again, if we could have motion 4I, please. That council approves amendments to bylaw 10 as set out in Appendix I. And again, before I ask for a mover or seconder, are there any questions for Lara regarding that motion? Nazir?
Perhaps it's already clear in the definitions, but I'm wondering if there's a requirement to clarify a member versus a public appointee. Is that already clarified in the bylaws, to my knowledge, or to your knowledge?
I can take that question. That's a good question. So to situate the conversation, bylaw 10 is with respect to remuneration of the members of councils and committees. So this is not involving public appointees. So bylaw 10 is about remuneration, and we don't remunerate the public appointees. So this would only be for members, so i.e. registrants, but we're adding subject matter experts as well, that they will be remunerated at the same rate as the members of council and non-council committee members. Does that answer your question, or would you have a follow-up that I could help with?
I might be splitting hairs, Sarah, so forgive me. I'm just thinking there's a publicly posted remuneration for public appointees.
Yes.
It's dramatically different than this.
Yes, yes.
And what I'm trying to avoid for the purposes of the council is a situation where, say, Dan, given all his years of experience and expertise, is appointed to a council member to a committee based on his subject matter expertise, and we're inhibited because of his from being able to do that.
Right. Okay. You brought up a very good example. Thank you for doing so. So those situations would be addressed actually in bylaw 9B, which was just passed. And just for convention, you might be wondering why we're adding 9B and 9A. I just wanted to say for clarity, we didn't want to put this section right at the end because it really belongs with the other committee members. So this new 9B sets out sort of the basic eligibility for subject matter experts. So Dan, for example, would not be eligible to be a subject matter expert because anyone who's a current or former employee of the college is not eligible. And the purpose of the SME is that you're providing a specific expertise. So in the context of the governance committee, that's governance expertise. Perhaps in the context of PLP, that would be insurance expertise. So SMEs are not just for governance, they could be for others, but right now, council has approved for governance, and the sort of the restrictions on who could be an SME is set out in 9B. So you identify a very important conflict there, and they need to be external. So no registrants as well, and no members of council.
Perfect clarity. Thank you so much.
Thank you for that. So if I could have that motion back on the screen, please. 4I, that council approves amendments to bylaw 10 as set on an Appendix I. And now I'm looking for a mover and a seconder, moved by Ellie, seconded by Deborah. All those in favor, please raise your virtual hand. Jamie, are you going to vote? Yes, I will. Thank you. So that is carried unanimously. Thank you all for that. Please lower your virtual hands. And my appreciation for going through this exercise, I think in fairness, we should have probably had someone walk around giving us treats after 9 motions like this. Maybe suggest that for the next meeting. I'm going to turn it back over to you, Lara, to just present us with next steps, please.
Thanks, Hanno. In terms of next steps, this afternoon, you're going to hear from the chair of the Eligibility Review Committee panel that selected the inaugural Governance Committee membership. She will present the proposed slate to council for appointment. The Governance Committee will commence work in October 2023. The first set of amendments related to election processes are expected to be brought to Council in December for its consideration. All recommendations for governance changes made by the Governance Committee will be brought to you for decision. I'd like to thank you for your attention, and I will turn it back to Hanno.
And thank you very much, Lara. The work you've done is really appreciated. Council, next on the agenda is an item also related to Governance Committee. In our last session, Council enacted the bylaw to authorize the Governance Committee to begin its work. Now you will consider the composition of the Governance Committee. This work is critical to ensure that Council remains current with best regulatory governance practice. This item is for decision. The materials for this item are at pages 268 to 283 every meeting package, and I'm going to turn it over to Dan to begin this discussion, please.
Thanks, Hanno. Everyone around this table knows that there's been a lot of work put into governance for the RCDSO, and today's meeting is a milestone. There's been a lot of work to date, and now we have a governance committee. And I'd like to introduce you to Maureen Boone. Maureen is the Registrar and CEO of the College of Massage Therapists of Ontario, and she's been a leading thinker and practitioner of governance and policy and health regulation for over 20 years. She actually served on our governance working group of a couple of years ago, and she's currently the chair of the Eligibility Review Committee that reviewed all of the applications that came related to the governance committee positions, and she interviewed candidates who applied to serve on that committee. So it's in that capacity that she's here today to present the slate. Maureen?
Hello, can you hear me?
Yes, we can.
Okay, great, thank you. Thanks for that, Dan, and I'm very pleased to present to you today on behalf of the Eligibility Review Committee. Next slide, please. Today, Council is asked to consider and approve the inaugural Governance Committee members and chair. And I'm going to give you a brief summary of the selection process, and you can keep your questions till the end if you don't mind. Next slide. So a few minutes ago, you passed bylaw amendments to operationalize an RCDSO governance committee, and congratulations on your bylaw bonanza. That's what we called it at our organization when we did this most recently. And the committee will determine the priorities and work plan for many of the other governance review and modernization strategic project components. Review proposals for additional governance reform, and make strategic recommendations to Council regarding governance modernization initiatives in preparation for the 2024 Council District election cycle. In June, I understand your Council approved the composition of the Governance Committee in principle, and this has been put into bylaw today. And the committee composition, as you see here, is 2 professional members of Council, 2 public members of Council, and at least 2 individuals external to the college with regulatory and governance expertise. Next slide. In June, Council also approved the selection process for the inaugural Governance Committee. Council determined that the Eligibility Review Committee, ERC, composed of external experts, would review and interview Governance Committee candidates and make recommendations to Council for the slate of proposed members and chair. Staff conducted recruitment throughout the summer. There was great interest, and 9 eligible candidates with diverse competencies, perspectives, and experience put their names forward. The panel of the ERC met 5 times to interview and assess the candidates and to form its recommendation for the inaugural Governance Committee members and chair. In the spirit of openness, I'd just like to acknowledge and make known that the panel members have worked in various capacities on regulatory committees and boards, with the 2 external subject matter experts being recommended for appointment. And that's because the regulatory community is somewhat small. Included in your package on pages 273 to 283 are CVs of the external subject matter experts. We recognize Council may not be as familiar with these individuals' backgrounds, so they're here for you to review. The panel considered the Governance Committee terms of reference and the guiding principles for governance, which reflects RCDSO's commitment to sound governance practices support effective decision-making in the public interest, which is the point of all of this, and serve as a framework within which council may chart out its future governance activities. The panel reviewed the candidate application packages, paying particular attention to governance committee competencies, experience, and diversity attributes to determine which committee members and chair selection would be best to create a diverse, balanced committee. The panel was very impressed with the caliber of candidates. It was a difficult decision, and everyone who took the time to participate in the selection process should be commended. On a personal note, I would just say that the people who applied were both interested and interesting, and the ERC enjoyed our conversations with all of them. Next slide, please. I will now present the recommended slate to council. The ERC panel recommends the following proposed inaugural governance committee slate: Anne Coughlin, Daniel Haas, Nizar Ladak, Anthony Mayer, Judy Welikovich, and Kathy Wilkie. The panel selected Anne Coughlin, one of the external subject matter experts, to serve as the chair of the inaugural committee. She has extensive governance experience and expertise in health regulation, and expressed an interest in chairing. And at this time, I'd be pleased to take any questions or comments from council.
Thank you. Thank you for that. Maureen, are there any questions at this point in time? Nazir?
Mr. Chair, from a procedural point of view, do you need these members to leave while you vote on their slate?
Yeah, so we talked about this beforehand, and we thought that council votes on its committee slate regularly. And so I'll look to Sarah for some advice. We don't think it's necessary, but if council thinks that it might be cleaner, then that's certainly something that we can do.
Comfortable with following past practice in that.
Daniel?
Just a follow-up question. If we are here, should we abstain on the vote? Thank you.
Yes.
Thank you. So are there any other questions? Thank you.
You can.
Okay. Maureen, on behalf of the council, I would like to thank you very much, not only for the work that you put into working with this group, but for your presentation and the way you walked it through for us. So thank you very much for joining us today and for the work you've done on behalf of this committee.
Thank you. It was a pleasure, and I thank my ERC, other members of the ERC, because our work is now done. So congratulations to you, to your council, on moving forward with your governance modernization.
Thank you very much, and have a good afternoon.
Thank you.
So Angelo, if I could have motion number 5 up on the screen now, please. I'm not going to reread the motion. It was read already, but you see the names in front of you, and also the name of the person who has been nominated as chair. This is simply a majority vote, so I'm not looking for 2/3, but I am going to look for the majority of people who are in favor. So at this point in time, I would ask, Ram, are you prepared to make that motion? Seconded by Deborah. All those in favor of the slate that is presented to you, please raise your hand. Okay, and that is carried unanimously. Thank you very much.
Can I ask whether or not, I think the minutes should reflect that the candidate abstained. Thank you. I think the minutes should also reflect that the 3 candidates present abstained from the vote.
Thank you for that. That will take course. Thank you very much for that, Judith. Okay, so that's been great. Council, we have certainly made up time. What we are going to do, though, we haven't finished the agenda in its entirety, but we are now going to move to our in-camera session. And when the in-camera session is completed, we will come back and just deal with the last few items that are on this agenda. So we will be going in camera. For the in-camera session, we will have just council members along with the registrar, deputy registrar, as well as Council Sarah Yun. We will be terminating our live stream. And what I'm looking for now, Angelo, if you could put motion number 6 on the screen, please. That council exclude the public from the meeting to receive legal advice and/or opinions from the college's solicitors in accordance with Clause 7(2)(e) of the Health Professions Procedural Code, which is Schedule 2 to the Regulated Health Professions Act 1991. That's moved by Jamie, seconded by Vivian. All those in favor, please raise your virtual hand. And that motion is carried. So we will pause for a moment or two until the people who are not supposed to be in this meeting have left the space for a short period of time.
Angie will stay. Okay. I'll just say a couple of words to introduce, and then I'll turn it over to our legal counsel. Perfect. You have to make sure the staff sign off. All of these people have to sign off. So, do you want me to mention that to Alderman? Yes, because some of these staff are.
Okay. Okay. So does that then address what your concern is? Okay.
improve. So I'd like to start with founding the work that we do in the college's objects under the Health Professions Procedural Code and the duty of the college. So one of the objects of the college is to develop standards of practice to assure the quality of the practice of dentistry. So those standards, the college has a number of them, but there's two in particular that were deemed to be higher risk areas of practice, and that's the use of sedation and general anesthesia in dental practice and dental CT scanners. So that's where the facility inspection program comes into play. We take a more hands-on approach with the implementation and enforcement of those particular standards. And that flows back into the duty of the college to protect the public interest. And we do so by ensuring the public has access to safe and high quality healthcare services. So the work we do in the program is really interesting because it intersects with a lot of different, all the three other regulatory areas and also the policy department's work. So we perform a registration type function in that we review the qualifications of dentists who are seeking to do these specific clinical acts of administering sedation or general anesthesia or taking dental CT scanners, and then we issue them certificates of authorizations, which gives them the authority to do those acts. We're similar to the Professional Conduct and Regulatory Affairs Department in that we do examine matters of compliance with the standards of practice. We work with the Quality Department and the Quality Assurance Committee to review training and education requirements to engage in specific areas of practice. And we work with the policy team on the development and updating of the standards that we oversee. So now I'm going to delve in a little bit more depth into the programs we run. So as I've mentioned, we have two standards that we oversee. So we have a program for each one of those standards. And the program elements and our authorities flow from the bylaws. So bylaw 20 is what sets out our authority and the elements of the CT inspection program. And bylaw 21 sets out the authority and elements of the sedation inspection program. You'll see here from this diagram that the programs really do mirror each other. Both of them have an authorization stream, which is the dentist's individual authority to perform the clinical acts, and they both have facility permits, which permits a facility to have an authorized dentist come in and perform the restricted clinical acts. All authorizations and facility permits need to be renewed on an annual basis. And during that renewal cycle, we do collect information about who is practicing at what facility and what levels of anesthesia they're administering or what types of dental CT scans they're taking. All dental facilities that have a facility permit are inspected on a 36-month cycle. And when we do our inspections of the dental facility, we also review the records of the authorized dentists that are practicing there. So inspections are routine events. They're unlike an investigation. Investigations really happen when an issue or a concern in someone's practice has been identified and it focuses on that. Inspections are different in that they're planned, they happen on a recurring schedule, they're broader in their examination. So when we conduct an inspection, there's not a specific concern that leads us to have that inspection. We go in and do a broad examination of the dental facility setup, the equipment at the dental office, and also the records of the authorized individuals who are working there. We conduct our first inspections before we issue an initial facility permit or in the early phases of issuing an authorization. With an initial inspection, if a facility is found to be compliant with the standard of practice, we then issue a facility permit, and they go into this ongoing cycle where they have these recurring touch points with the facility inspection program. So that's the annual renewals that I've already spoken to and the re-inspections every 36 months. If the If we find during a reinspection that a facility is not fully compliant with the standard of practice, we can take a number of different escalating outcomes. The first is if we find that there are some minor issues with the dental facility, we typically offer remedial feedback. And depending on the nature of that feedback, we may conduct a follow-up inspection to ensure that that feedback has been incorporated into practice. If we find during a reinspection that some equipment has not been tested or maintained as required by the standard of practice, or there's missing equipment or emergency drugs, in those instances, it's more of a moderate risk level, so we direct the facility to immediately stop performing those clinical acts while the deficiencies are addressed. In the most serious of cases where we find that there's a high risk acts that are taking place, we do have the option to refer matters to the registrar to consider appointment of an investigation under Section 75 of the Act. So now I'm going to switch gears a little bit and I'm going to walk you through the application, facility permit application steps, starting with the dental CT scanners. And the purpose of this exercise is twofold. We want council to understand the application process in the event that you receive questions about it, but it will also help explain the two new charts that you received on the operational dashboard today. So I'll be taking a moment to review those in a little bit more depth than we did this morning. So for dental CT scanners, our application process does involve quite a number of steps, and there is a shared responsibility in oversight with the Ministry of Health. So it all starts, of course, with the decision to purchase a dental CT scanner. But then the college becomes immediately involved before the dentist takes steps to have that machine delivered and installed at their facility. They actually need to submit their application to the college. And the reason for that is that the college then issues a letter to the Ministry of Health and a letter to the applicant approving the application in principle. And that letter that we send the Ministry of Health forms part of their records and part of their application process. So after that, things are out of the hands of the college for a little bit. So we do keep the applications open and they're on hold while the applicant then goes and completes the other steps necessary to install the CT scanner. So that starts with them submitting their application to the Ministry of Health, who by this point already has a pre-approval letter from the college. What the applicant needs to obtain from the Ministry of Health is a letter of designation for their dental facility, and that designates them as a facility that can have a dental CT scanner. And they also need to obtain approval of the installation plan. So the Ministry of Health is more hands-on in reviewing all of the protection screening that's going to be in the facility around the CT scanner. It's only after those steps are done that the applicant then can renovate their facility or do construction. And this is where we start to see our application process gets very extended, because this is out of the control of the college and at times can be out of the control of the applicant. Specifically during the heights of the COVID-19 pandemic, we were hearing from many applicants that they were struggling to have the construction done that they needed to install their dental CT scanners. So they were unable to move their applications forward for quite a period of time. After the facility is set up in accordance with the installation plan, the applicant then can install the dental CT scanner. The CT scanner has to be tested in accordance with the HARP Act and the standard of practice, and the applicant receives training. Then the applicant can finalize their quality assurance program, which is the program that they're going to implement at their facility to ensure the machine is regularly tested and maintained as required by the HARP Act and the standard. And they also develop facility-specific protocols and procedures for the taking of dental CT scans. So it's only after those steps 4 through 8 that are done by the applicant that the matter comes back to the college. So once that's all done, the applicant can come to us and request a facility inspection, at which point we'll assign an inspector to conduct the facility inspection, and if they're in compliance with the standard, we can issue the CT facility permit. So with that in mind, I'll take you to the chart that was on the operational dashboard. So this is one of the new charts, and it focuses on open CT facility permit applications. And as you'll note from this, it's quite striking. We are talking about applications that are open for a number of years, and it's because of that 11-step process and that the college is involved at the outset and then not again to the tail end. So there's quite a significant period of time in between where the applicant's working on things and it's out of the control of the college. We have been making strides to address and move forward our applications, but you'll note we do have some still open from 2020 and 2021. The reason why we're not calling these backlog applications is because they're actually in our current process. So our backlog was really trying to address applications that were filed under old bylaw provisions that are no longer in existence and closing those out. These ones are all under the current application process, but another reason that they're not backlogged is that the applicants are actually not ready to have a facility inspection, so we're a bit of a holding pattern with these 27 cases from 2020 and 2021. We are going to be making an effort to move those applicants forward, and we hope to have them closed out by the beginning of 2024. So with that, I'm going to move on to the sedation program. Rest assured, it's much simpler. The steps to obtain a sedation facility permit actually can all fit on one slide. So similar to CT, it does start with just making that decision to obtain a sedation facility permit. But then right away, the applicant can take steps to obtain all the required equipment and emergency drugs. They don't need to start by submitting an application to us. So in theory, the applicant should be getting the facility fully set up before they start their application process with the college. Once the facility is set up, they submit an application to us, and then the next 3 steps are really all in the control of the college, and they tend to flow pretty seamless. We can assign an inspector and conduct the inspection, usually within 4 weeks, and then depending on the results, we're able to issue the sedation facility permit in short order. So that takes us to the second chart that was on the operational dashboard for the first time at this meeting. And here we have the average days to issue a sedation facility permit, and we've broken out the data into facilities that are found to not have deficiencies during their initial inspection and facilities that do have deficiencies during their initial inspections. You'll note from here that we're talking about a matter of months, not years, as with CT. And again, that ties back to the application process being quite different and that it doesn't involve the Ministry of Health. So for facilities that are found to be compliant during that initial inspection, we're typically able to maintain processing times from the point of submission of the application to issuing the facility permit around 2 months. You'll note that there was a bit of an anomaly in April, and that's a recurring issue. And the reason for that is that typically if we're ready to issue an application once renewal has started for sedation, so that's February and March of the year, the applicants will ask that we don't issue it because they don't want to have to immediately renew their permit. So every year in April, we have a higher volume of facility permits that we issue, and they tend to be holdovers at the request of the applicant. So there's always that anomaly in the data, but otherwise we're aiming to maintain processing times of around 2 months or less. With the facilities that have deficiencies during the inspection, it can be quite variable, and sometimes that's out of the control of both the applicant and the college. What we've seen during the COVID-19 pandemics, and it has persisted, is that there's often drug shortages or difficulty in obtaining certain equipment, and that may cause a delay in being able to issue the facility permit, again, through no fault of the applicant or through the college. So we're separating that out in our data reporting. So with that, I'd like to conclude by covering a few of the recent developments in the facility inspection program and give you a glimpse of what we hope to achieve in the near future. So we had a really packed last few years. In late 2020, there was substantive bylaw amendments that came into effect for both sedation and CT. So we brought in the requirement to have authorization to administer minimal sedation. That wasn't a requirement prior to the bylaw amendments coming into effect in 2020. And then for CT, we made some amendments to the bylaws to have the program more closely mirror sedation. So we brought in the requirement to have authorizations to prescribe, order, take, interpret, or report on dental CT scans. Prior to 2020, we would register individuals on a facility permit, but they didn't have their own authorization, so now they have their own authorization. And we also eliminated the provisional facility permits, which were a temporary permit that we used to issue before we conducted an initial inspection. So as of late 2020, we haven't issued any new provisional facility permits. Through 2021, we were really focused on the implementation of these new bylaw provisions. They were quite substantial. The minimal sedation authorized members make up a majority of members that we interact with. We typically have around 4,000, so that did require some adjustment on our end through 2021. And also adding the authorizations to CT was a whole new application stream that we had to absorb and adjust through 2021. Also in 2021, across the college, we were transitioning our CRM to the new bridge system, as council's aware. For the facility inspection program, we are the holder of records for authorized members and facilities with facility permits, so we did have to work closely with IT on that work through 2021. From 2022 into mid-2023, there's been a lot of different activities going on. It's been a really exciting time to be with the facility inspection program. We've been making more of an effort to engage the Quality Assurance Committee on ongoing issues with implementations of the standards. And what we're seeing is how dentistry is practiced and the realities that you face every day are constantly changing. So this does bring up new implementation questions over time, even though we've had these standards around for quite some time. We've also been addressing the CT facility permit application backlog, and that was the chart that councils had on the operational dashboard for the last few meetings, where we were making an effort to close out all of those provisional facility permits that we stopped issuing in 2020 and convert them to the annual facility permit cycle or close them out if the applicants decided not to have a dental CT scanner anymore. We've also been really working to set ourselves up to collect data. As we are across the college, we're trying to make data-based decision-making and assessing risk in a more detailed manner. We've also been updating resources for the members and registrants, and the purpose of that is to really facilitate compliance with the standard. So we've started with the sedation program. Recently, we updated all of our website content, and as of this week, we've implemented new updated guides and checklists to help facilities prepare for their initial and re-inspections, and those are now available on our website. So for the rest of 2023 into 2024, we're going to continue with developing our resources. We're now switching gears to CT. So over the next few months, we're aiming to update our CT website content and also develop up-to-date guides and checklists for members who are going to be undergoing CT facility inspections. We're also going to be working on developing a risk framework. This, again, is work that's happening across the college. So for the facility inspection program, we're going to be developing a framework that will drive our decision-making or the outcomes of an inspection based on the associated patient risk. And we will be working with the other regulatory areas, registration, quality, and PCRA to ensure that the risk frameworks are aligned. And then also lastly, through 2024, we're going to be doing a really detailed critical review of the CT program. We've heard from the registrants that the application process can be cumbersome and frustrating at times. We've heard that, we echo it. It is quite detailed. We're quite confident that with a critical review, we're going to be able to find some efficiencies and work more simultaneously with the Ministry of Health on those applications. We're also going to be reviewing our program elements. As I covered at the beginning, the CT program was set up to mirror the sedation program. They're wildly different areas of dental practice with different associated risks. So we want to make sure that we are striking the right balance, and we'll be reviewing those program elements to test whether we've still are striking the right balance there. So with that, I'm happy to take questions from council.
Thank you very much, Danielle. Are there any questions for Danielle at this time? Jamie.
Thank you, Danielle. For my edification, given you've indicated that these are high-risk procedures, do you know if all the dentists practicing in these areas are covered by PLP, or is there a requirement for additional insurance to operate these facilities? Thank you.
To my knowledge, they do fall under the regular PLP, but perhaps I'm not sure if someone else can speak to additional coverage.
Daniel?
If I may, my understanding is the answer is yes, everyone's covered by PLP. Many practitioners will also take out additional insurance on top of the PLP, but it's an individual's decision.
Usama, you had your hand up. Okay, thank you. Nalin?
A great presentation, Danielle. Just a question. Just anecdotally, it seems to me that the number of dentists getting CT and CBCT scanners and machines is going up. So do you feel that you're adequately staffed for the future?
That's why we've been really focusing on trying to collect data. Anecdotally, I think you're correct, but we don't have the data yet to demonstrate that. So we're going to be exploring what information we have through the past systems that we use, our old CRN system and the bridge, to see if we can start to map some of those trends. As of right now, we've made significant progress on the backlog, so I think we're adequately staffed through 2024. But as we review the CT program itself and the elements, we'll also be reviewing our staffing to ensure it's adequate.
Thank you, Usama. Oh.
I do have a question this time. Do you think that the rate limiting step for the facility inspections is a lack of staff that can go to the facilities and do the inspections?
At times, it has been a struggle to have, we do require inspectors that are experts in the area, and so we do recruit on a regular basis. But as of right now, we actually don't have a backlog of people waiting for inspections. We find that it's a matter of trying to find a time that the facility can make themselves available is often the issue, because it does require a practitioner to take some time away from their daily practice.
I do have, as a possible recommendation, have you guys thought of maybe some sort of online booking system that could, you give the facility multiple dates? Because I do know, particularly even for me, that was a big factor, because you book patients out, right? And then you can't, cancel a full day of patients with, 2 weeks or 3 weeks notice. So if there's a possibility for, like a 3-month window with like an online booking system where you can kind of pick the different dates, and that could be easily done. I'm not sure if that's been thought. I'm sure it's been thought of, but yeah.
Absolutely. That is a great suggestion. And that is where I see things going in the future. We would need to address the schedules of our inspectors before we can implement something like that. As of right now, because our inspectors are dentists who are engaged in practice themselves, we do allow them to take care of the bookings themselves, but I do see the benefit of that more administrative type work falling to the college staff, and that would free up the inspector for the more clinical aspects of it. So we'll be reviewing that and considering it as a possible process improvement down the road.
Thank you. I have no other speakers on my list. So seeing none, Danielle, I would like to thank you on behalf of council for taking the time and come and your very interesting and informative presentation. So thank you for doing that. Members of council, we're looking at item number 14 on the agenda. This next item cover reports for council information. These reports are included in your package starting at page 284 with the Access to Care update and finishing at page 300 with the correspondence from the RCDSO to the Ontario Fairness Commissioner, June 20th, 2023. These reports are for your information. I encourage you to read them for your ongoing education. I'm going to refer to each information topic one at a time to see if anyone has any questions. There will be no introduction or discussion unless you have a question. Remember, all these items are here for council's information only. I'm going to go in the order in which the information items are listed in your materials. So to begin with, starting with the Access to Care update briefing note. Any questions? Next to the update to OHIP fee schedule, diagnostic procedures, and specialist consultations. Any questions? The Commission on Dental Accreditation Canada, CDAC note. Any questions? And lastly, correspondence from the RCDSO to the Ontario Fairness Commissioner, June 20th, 2023. Any questions? Okay, thank you, Council. Brief reminder that our next meeting will be a virtual meeting and is going to be held on December 7th, 2023, and the December meeting will be live streamed as usual. And before I ask for a motion to adjourn, I would like to take again the opportunity, not only on my behalf, but on behalf of council, to thank all of staff, all of the people who are sitting in this room right now, and all of the people whose voices we only hear via computer, but are elsewhere doing the incredible amount of work that they continue to do and have done to organize this meeting. I'm sure regular meetings are hard enough to organize. I'm sure hybrid meetings just add to that burden. And the way in which college staff supports us, handles us in such an incredibly professional and friendly and caring manner is greatly appreciated by all of us, because I know reality for me is I could not be doing what I'm doing without that support. So I would like to take the opportunity to thank everyone who is in this room, not sitting in this U-shaped table. Not that council doesn't need to be thanked, but everyone else who is not present in this room but can hear my voice at this point in time and my appreciation on behalf of council. Thank you as well, council members. This format has been a little bit different in terms of the way this agenda has been structured. Hopefully, it reflects the feedback that you have provided over the last few months. As I said at the very beginning of the meeting, I know it's very important for the registrar, the president, and staff to incorporate the feedback that they get in terms of how these meetings are run and how to structure these meetings. And I think that was very visible today in the amount of time that was given specifically around the PLP discussion to ensure that as many people could speak as often as they needed to in terms of asking a question or making a comment. So on behalf of myself, again, I would like to thank the registrar, the president, and the staff for setting up or creating the agenda to reflect that. And at this point in time, anything from you, Dan? Harinder?
Yeah. Thank you, Hanno. I want to acknowledge the chair, Hanno, for running this great meeting, keeping us in control. Thank you so much, Hanno. And also I want to acknowledge Dan's leadership, staff's contribution to making these meetings possible and run on time and flawlessly, and the council members. Thank you so much, and have a great fall, and we'll see you virtually in December. Thank you.
Now, I am going to ask just for clarification. I see a few hands up here. I don't know if there are questions or if that was clapping. So, or it could be motions to adjourn. Okay, that's okay. I guess enough with the talking, right? Let's get to the real thing. So, Anthony, is this a question or motion to adjourn? Anthony, did you have a?
Motion to adjourn.
Okay,
Motion to
moved by
adjourn.
Anthony, seconded by Mark Eckler. All those in favor? And that motion is carried. Thank you all, and thank you for coming. Have a good journey home, and have a good fall.